Welcome to the very first episode of Hospital Hell Healthcare Nightmares featuring Fort Lauderdale, Broward County's worst rated hospitals. In this report, we'll delve into one-star reviews from some of the lowest rated hospitals in Broward County, Florida. Our focus will be on four specific healthcare institutions: Broward Health Medical Center, Florida Medical Center, Broward Health Coral Springs, and Broward Health Imperial Point. These hospitals have garnered reputations for subpar care and patient satisfaction. My aim is to illuminate the concerns, criticisms, and experiences shared by patients and their families. By examining these one-star reviews, I hope to shed light on the challenges within these healthcare facilities and foster a constructive dialogue about healthcare reform and improvements in Broward County. Every healthcare institution featured in this program has received more one-star reviews than five-star reviews. First up is Broward Health Medical Center on South Andrews Avenue in Fort Lauderdale. Vomited blood, waiting a quick 3 hours on the floor from the pain. Vomited again in front of registration staff they called EVS. EVS don't work here, apparently. 3 hours later, still vomit on the floor. Included a nice pic of me on the floor waiting to be called. P.S. They play loud African beat music in the ER. See these photos. I guess that's where they didn't clean it. My father is 70 years old, was treated poorly after visiting hours. Please don't bring your parents or grandparents for treatment or for admitting. After visiting hours are over the hospital, don't check up on the patients who can't speak for themselves. No food or drinks is given, no medication. Don't answer the patient buzzer button. The RN nurse name Ashley, nighttime shift, 6th floor, building 6, was very rude and no proper care for my father. 10/08/2022. Night shift RN, please look at the photos. My father room very dirty, and he could have even reached his phone because it was on the floor. Also, the nurse never take my elderly father a shower or change his urinal cup. His throw up was never cleaned. No medication for pain. This whole night staff should be replaced, starting with the nurse. RN Ashley, nurse, 6th floor, 6 tower, night shift. RN nurse, please suspend or fire her. Accident 10/08/2022. That's extremely specific for them to put the person's name and everything like that. So I guess it's just generally untidy. Yeah, I see. I'm only going to read the ones with 3 or more likes because otherwise there are just so many. How this is funny. You're better off getting care in a Civil War hospital. I had an absolutely horrifying experience at Broward Health Medical Center. Not only did they fail to provide adequate care for emergency surgery, but the nurses in the post-op room ignored screams for help and did nothing to alleviate intense pain for over 30 minutes. The only reason I received the necessary medication was because my trusted confidant, who happens to be the emergency first aid responder instructor, intervened and obtained the care necessary. The lack of care resulted in extreme stress on the heart and nearly resulted in death. To make matters worse, after successfully ensured proper care was received, hospital security removed her from the premises for trespassing. It is appalling that the hospital would choose to prioritize their own bureaucracy over the well-being of their patients. This entire experience was a nightmare. I would strongly advise against using this hospital for any medical needs, as their lack of care and disregard for patient safety is completely unacceptable. This is 6 months ago. A lot of people saying it's the worst. Don't come here. I go in for chest pain. The ER staff was pleasant and the nursing staff was also pleasant. However, I never saw a cardiologist and the attending doctor was kicking me out. He got upset with me in regards to me experiencing chest pain. Meanwhile, I'm still experiencing chest pain and he didn't put any orders in. It was like I was bothering him. I will never come back here again. If I could give this hospital 0 stars, I would. There's absolutely no knowledge, care, empathy, or mercy when I was staying here for days. Other than Dr. Jordan, who is incredible, the whole staff showed how desensitized the healthcare field is. Most of the staff had zero clue why I was in the hospital or what I needed. Keep in mind, I needed emergency surgery on my ovary. Absolutely horrible experience I would never wish upon anyone else. The entire staff needs to be retrained on what it means to work in the healthcare field. What a horrible experience it was. Everybody at the ER is extremely rude and careless. Hospital is super understaffed right now, must be for a reason. 5 hours just waiting to get in after originally coming in for a split open chin with foot and knee bruises. The guy at the front desk used his commonly used line, "If someone has chest pains, I have to prioritize them first," which is fine, but then you have an older gentleman with chest pains come in and you tell him that there's a 2-hour, 18-minute wait? Ridiculous. Place is dirty, smelly, people with legit emergencies waiting while they're just letting the easy ones in to get it out of the way. This was discriminatory and disrespectful. that kind of poor customer service this hospital has. Close it now. It is not safe. Okay. I don't recommend coming here. I'm in disbelief at how they treated my sister. She got into a car accident and had a broken nose. Facial surgeon didn't wipe her face. He gave water and gauze to my mom so she could do it. Not to mention, prior to him getting to the room, she was sitting there with the blood all over her face for a long time with little to no information. She tried getting her belongings, purse and phone, multiple times, and before they finally gave it to her, they said, "We're not sure where it is." Awful staff. The nurses were great, though. 0 out of 0. Completely disgusted with them. Never again. That's generally all I will say, but to put some context into my experience, which was relatively short, was nothing less than atrocious. First of all, the waiting room reeked of urine, with some people laid out sleeping as though they've been waiting a millennia to be seen. The nurse kept telling me, "Have a seat, someone will call you," but continued to laugh and chat with at least 4 nurses. Decided to cut my wristband and walk out and take my medical concerns elsewhere. This, the worst hospital. Last week I was suffering with a severe migraine headache. I went to Broward General ER. I signed in at 3:15 p.m. I told the lady I'm pregnant and I'm in a lot of pain. I can't barely hold myself. That place was packed. Barely any place to sit in the waiting room. Over 6 hours waiting to get checked by the doctor. My experience there was terrible. On top of that, my husband ended up sick with the flu due to so many people who was in the waiting coughing and squeezing. Not once I saw anyone from that place spray some Lysol to kill bacteria. They are way understaffed. They have no mannerisms. I'm reporting Alvarez, Ambes, MD, Atena to the DBPR, as well as filling a complaint to any and all resources I have available. I was at the hospital for over 8 hours. Furthermore, she never indicated that my white blood cells count are very high, which is obviously an infection. This particular doctor maybe stayed in my room, give or take a total of 7 minutes altogether. I will also be reporting the hospital to necessary resources. The doctor came in my room and said, "Oh, it's not life-threatening. Sorry, but I can't do anything." Well, my white blood cells count was high, which I was never told. I will take this to the necessary extremes. I just got home from a 2-night stay at this pathetic and abusive hospital. I would give it 0 stars if I could. I was transported by ambulance from a cruise. The ER nurse was kind and helpful, but the hell started once I was admitted. First of all, the doctors did not listen to me or read the packet of info provided, which was an incident report of what had happened. The ER visit would have been sufficient as they ran tests and scans and all was good to go. However, once admitted, I only saw one doctor in the 48 hours I was admitted, who lied and told me, in fact, been seen by another doctor. Then every nurse, except for the one that I had the last night who discharged me, was rude, talked over me, did not take precautions when it came to my medicinal and allergies, and in general were just horrible examples of medical professionals. The room and bathroom were never cleaned while I was there, not once. There was a slime of grease and hair caught in the hinges of the bed I laid upon. The sheets and blankets felt like they were one step down from paper towel. I don't know if the nurses ever washes their hands. It was filthy. It was worse than what I would expect a prison infirmary to be. Run, run, run far, far away from Broward Health Medical Center. Run. 7 months ago. This is a good place to go to die. I'm on day 3 following a stroke and hasn't seen a neurologist yet. The kicker, the neurologist assigned to my case won't clear me for discharge until he sees me. Okay, a year ago. I had an awful experience last night at Broward Health. I was rushed in the ambulance due to my tachycardia. My oxygen was low and my heart rate was super high. Everything was numb and fuzzy. Regardless of the situation, I was treated with much disrespect. I am also autistic, and they put me in the most busiest hallway they had, and I had a sensory blowout and had to leave the hospital before any test results were given to me. They hooked me on the monitor until my heart rate was 91 and then immediately took me off everything when with tachycardia your heart rate jumps up and down. I will never step back into this hospital ever again, even if I'm dying. I will find a way to get to a different hospital. Congratulations on having such incompetence. A year ago, my father is in this hospital and they are the absolute worst hospital ever. Never answer the phones at the nurse's station, and if someone does pick up, it's like you're bothering them. The doctor in control of my father's well-being is the most rudest person I've ever talked to, threatening me and my brother, saying, "We're kicking your dad out of the hospital. You better come up with something now so he has somewhere to stay." Now, who does that? My dad has cirrhosis of the liver and needs a liver and lung transplant and needs oxygen for the rest of his life, which may only be 2 years, but how dare you all should be ashamed. A year ago. I found the treatment and service in the emergency room was great. Unfortunately, I was moved to 3 North Tower. Here, things fell apart. The place is dirty. They forgot to give me a pillow or tell me how to call the nurse if I needed her. There's probably good reason for this, as they do not want to give you the time of day. I have been here 2 days now and still have no idea about any of the tests I have done. I do not know if the tests are good or bad, or any idea how long I might be here. They keep telling me I will be gone. It would be fine if I wasn't a single dad who has 2 children at home who are very worried as their mother passed away here 1 year ago. Wow. Okay, 7 months ago. Please, if you value your life or loved one's life, never go here. You will be mistreated, given all necessary procedures and surgeries, and neglected to be taken care of. Avoid at all costs and go to any other hospital. I went to the ER at 4:30 p.m. The waiting room, patient's room, and hallways were very dirty, and the bathroom was disgusting. I was not called for vitals until 7:45 p.m. I was given a cup to pee in and told to keep it with me until I was called back. I was not put into an exam room until 10:30 p.m. Once I was in the room, the physician did not see me until 11:40 p.m. He then ordered some tests that took another 2 hours. I was discharged at 3 a.m. and told to follow up with my primary doctor. I felt even worse than when I had came in. This hospital has gone downhill. The staff are very unprofessional and rude. The wait time is extremely ridiculous. Due to the fact I was not feeling well, I went to Holy Cross Hospital later that day. I was admitted and spent a week in the hospital. I could not believe Broward Health sent me home in the first place. I will never return to any Broward Health hospital or recommend it to anyone. The emergency room is one of the cleanest ones I have been in, but that's where the praise stops. They are so slow. I have been here since early afternoon. The nurses at the time were nice and polite. Once the shift changed, the new nurse were the nurses from hell. The nurse were rude and had a nasty attitude. Me and another lady wanted into the ER at the same time, and she walked out just now while I'm still in the waiting room waiting to be seen. Sanitation procedures are not being used here. I don't feel like that are doing everything that can be done to keep everyone safe. It seems like it takes 2+ hours to do everything. 2+ hour wait for blood work, in addition 2+ hour wait for the test result. Another 2+ hours to see the doctor. I am on the verge of walking out. I will never come here again. All right, a year ago. Attention board members and leaders at Broward Health Medical Center. Please take a moment to read the reviews related to the staff at Broward Health. Is this how you expect operations to run? My mother was recently hospitalized here, and there was an abundance of unprofessional behavior. She, an elderly woman, did not receive the care she needed. Instead, the nurses are cracking jokes outside, giggling with each other. When she would finally receive care, it was the bare minimum. I was doing everything from assisting her to go to the bathroom, getting showered, everything. If I did not visit daily, I'm afraid to know what would have happened to her. Please evaluate your staff and the processes in place. Start with the cardiac floor. 2 years ago. Cannot even begin to say how concerned I am. First of all, I am pregnant and supposed to have my baby at this hospital. My husband was recently in this emergency room trauma unit because of a motorcycle accident, and they put him in the hallway with 3 other people even though he was in serious condition and had a heart attack a few moments earlier. They did not even sit up his bed. They had him laying in the hallway on the stretcher. Second of all, I asked for water for both of us and was ignored 4 times before having to raise my voice about us being thirsty and finally them getting water. This concerns me because I'm visibly pregnant and he was visibly injured, and we couldn't even get us simple water, yet alone no meds, until I had to track down the 3rd nurse asking for this. Third, the waiting room had me wait even after they called the front to say I could go back and see him. They had me stand there while the nurse told someone where the bathroom was. The doctor barely acknowledged that my husband was injured and told him the faster he could get up, the faster he could leave. They did not even give us a wheelchair. We had to find one on the way out. His arms were all bloody and they put no band-aids or cleaned up anything. Such a sad excuse for staff. 4 years ago is a long time. I don't know if I'm going to do ancient history. 2 years ago might need to be the max. Okay, a year ago. It was my first time visiting, and I'll never go back to Broward General ever again. Wait time's long, nobody listens, and when you ask the staff a question, they all get dumb looks on their faces. Front desk service is even bad. They have people with very weird attitudes greeting you. Again, my first experience and my last, unless I need another doctor's note, which I will because the nurse didn't listen. 2 years ago. I was visiting from out of state when I unfortunately ended up having to take an ambulance to the hospital. The staff was not kind or compassionate. I could hear the nurse in the hallway saying my friend was crazy and someone needed to let her in. The front desk receptionist was awful. ask her to call a taxi because both our phones were dead. As she rolled her eyes and made us think about it, she did. I was sitting down because I had low blood pressure. The receptionist told us we needed to be outside waiting. As we were outside waiting on the curb, she came outside to yell at us to inform us we had to be outside. Clearly, we were. I also found it odd they don't educate what their tests are. I declined a CAT scan. They said fine instead of letting me know what a CAT scan will show. Overall, it was a horrible experience. The only person who was good was a kind man at the end getting my health insurance to discharge me. All right, 7 months ago. Absolutely the worst hospital I've ever been to, including third world countries. You could probably die waiting in the ER room while no one will help you. Honestly disappointed and disgusted. Someone please help this place. A year ago, this is 0 star. This place is horrible. My mom went in and with some mobility. She spent 3.5 weeks here and came out with no mobility due to being bedridden with no PT or OT. Nicole, a caseworker in the 6th tower, only worked on switching mom's dialysis in a different state. I had to rush to get her set up here, but Nicole failed to let me know that mom lost her mobility. I called numerous times, but she never answered my calls. I called Tanya Kraus, apparently an administrator caseworker, said since your mom was discharged, it was not their job and that it was mine to find her a rehab. Why didn't they do their job to begin with before my mom was discharged? Then she mentioned if something should happen to my mom to go to the nearest hospital and not there, possibly because they were negligent. Less than 36 hours later, my mom ended up back there via paramedics because she fell. The first time they lost her clothes and shoes, and it took them almost 3 hours to find them. Now, the second time my mom was there before she was being transported to a rehab, a big thank you to Ash and Debbie and 4 North Tower for everything. You both are awesome. You both were awesome getting mom a rehab facility. The hospital lost her clothes, so she has nothing but a hospital gown. I was born at Broward General, this hospital, under the old name 45 years ago, and I am ashamed of what this hospital became. All right, a year ago. Sorriest pediatric hospital ever. No nurse staff, no beds available. Nurse on staff are disrespectful, no sympathy or empathy for aching patients. Wait in waiting room for over 2 hours before seeing a nurse on staff or to get in a bed. I would never recommend this pediatric care for urgent care for nothing. I'm not a regular at a hospital, not a fan of this hospital. I would prefer Northwest Medical Center any day, or Boca Regional, sad to say. At least their health services are prompt in a timely manner and some type of care is shown and given. As soon as you walk through the door, I knew we would just be another number. Sad to say this hospital needs a lot of improvement. Okay, a year ago. Once you enter this hospital, expect to leave in a body bag. My mother was admitted for a fall. Since I live out of town, I called every day to make sure she was getting her 5 heart medications. I was repeatedly told she would get them, but 9 days later, she still did not have her medications, despite the fact they were faxed twice. The social workers lie or hang up on you, won't spend a minute to discuss your family member. The doctor that was assigned to her wasn't told she was his patient until 9 days later, and only then did she receive her medications. By then it was too late, and she passed away from cardiac arrest. I was told my mother was in stage 4 renal failure. Then why did the death certificate say she died from hypertension and heart disease? And I almost forgot to mention the hospital claimed my mother had COVID with no symptoms when she arrived and kept her in total isolation. They continued to say she had COVID for 12 days. Hospitals are hoping the patients will die from COVID as they are paid big money by the government if that occurs. Do not send your loved ones to this hell on earth. Jesus, that is fucked. If I had ever felt as though I was walking into high school, this would be it. Nurses standing together laughing like they are teenagers and being rude and disrespectful. The ones who did my ultrasound was very nice and respectful, but many were not, especially the ones checking people in. Very judgmental. A year ago. Worst medical facility I've ever been to. Nurses, hospital staff referred to me as diarrhea girl outside my room. Completely disrespectful and disgraceful, especially as someone who was ill in the waiting room for 3.5+ hours. The overall hospital was dirty. The medical staff helping me seemed disorientated and confused. I left feeling worse than when I came in. The only silver lining was the man wearing a mustard sweater at the front desk. He was an angel. All right, this is a year ago. My sister, who is over 70 years of age, was admitted Friday evening, 12/24, with severe stomach pain. A doctor on staff looked at her and had a CT scan done, but admitted he had no idea what was wrong with her. All day Saturday, she was in severe pain, and no gastroenterologist was called in to see her. They claimed they were too busy to do an ultrasound. Multiple times she asked the nurses to call the hospitalist doctor, and they refused to call him. They kept telling her it's Christmas while the pain medicine was doing nothing. Here it is Sunday morning and still waiting for an ultrasound while she is in severe pain. She can barely talk on the phone because of the pain she is in and says the attitude of the nurses is horrible. There is no excuse for not having a specialist see her because of a holiday, and it should not take more than 24 hours to do an ultrasound. A follow up to this review. They released her Sunday evening and was in the emergency room at Holy Cross Monday morning. Turns out Broward Health misdiagnosed her as her intestines and appendix were twisted and had to have surgery. Doctors didn't understand why Broward did not give her morphine for her pain. She is still in the hospital trying to recover. Also, when admitted to Holy Cross, she found out she had COVID from being at Broward. Thank goodness she has had the 3 shots. 2 years ago, walked into the emergency room with no one waiting, but waited an hour before asking a lady at the desk for an update, and she informed me that they are getting my room ready. She also clarified the room number. Waited a little while longer to ask the man at the desk, and he informed me of the same thing. Was going to walk out, but I had spent so much time already. At that time, it's a little after 5 a.m. Asked to speak to someone in charge, and the charge nurse Chris came out and say they are short-staffed. Okay, so I asked more questions because it seemed like I would be there for a couple of more hours since they are short-staffed. While I asked questions, he became irritable, but clarified that housekeeping was short on staff and said he will find me a room. He found me a room and told me to sit down, not caring that the bed had a blood stain on it, and took me to another room. When asked if that room was sanitized, he gave me an attitude by the mouth and body language. At this point, I definitely walked out and will be speaking to his boss about how unprofessional the ER is. I clearly understand why the rating is so low. Okay, a year ago. In October, I was in a car accident and the airbag stung my left eye, leaving me blind. They first diagnosed it as just conjunctivitis, but that was not the case at all. Every nurse was meaner and not willing to help in any capacity. I think they had a judgment toward who I was. They had security guard put me behind the building, handcuffed outside in the blazing sun with no water or anything. After a few hours, the same security guard took the handcuffs off and threw me out the back door. I had to lay in the middle of the street to get help. I was so weak from not eating or drinking anything. These people take an oath to take care of people no matter what, but deaf not the workers here. I have a lawsuit pending, so I can't say too much, but please, please, please do not go here. There are a bunch of young nurses that have bad attitudes and withhold food and drink. Also, my stiff mysteriously disappeared when I left my cell phone a year ago. Oh, where to begin? This facility should be shut down. My mom fell while on vacation and was brought to this facility by ambulance. She injured both ankles and they took x-rays that were negative. Upon putting her in a boot and attempting to have her stand, she was still non-weight bearing. I was out of town and she was updating me by text. I suggested a CT to make sure the x-rays didn't miss anything since that happens, and she was told we don't do extremity CTs in the ED, which is ridiculous. They eventually did the CT and found both ankles were fractured. Skip ahead to the middle of the night. My mom has been admitted and is being told by nurses that she will be having surgery on her left ankle. Remember that, it's important later. At no time has anyone reviewed her images with her, and no surgeon has come in to speak with her regarding what exactly they plan on doing. My mom decides she doesn't want surgery there and would like to return home to be near family. Upon expressing this, she was told there was no way for her to be transported, untrue, and that if she signed herself out AMA, Medicare wouldn't pay her medical bills and she'd be stuck paying out of pocket, also untrue. She finally encountered someone reasonable, Dr. Sherman, I believe, who is able to facilitate her desires. She is now home and has received a second opinion, which concluded her right ankle was worse than her left and no surgery was indicated. This hospital is essentially trying to bully my mom into a surgery that was not indicated, I can only assume for the Medicare reimbursement. A formal complaint with CMS is forthcoming. Do not let this facility touch you. Jesus. Alright, a year ago. Awful facility. If I could give it 0 stars, I would. Disrespectful and unprofessional staff. You can get better diagnosis and treatments in the morgue than at this place. They are quick to discharge a patient before properly treating them. Then what's the point of a hospital if a person leaves in a worse condition than before entering? Packages at an Amazon warehouse get treated with better care than people do at this here clown facility. A year ago. The nurses are horrible. They don't care about the patients. They're just there to make money, and that goes for the doctors as well. My doctor had a bad cough. They refused to give her any medication to relieve the cough, and she was hospitalized for almost 2 days. This hospital needs a new team. All right. A year ago, we went to ED for a jaw chin split with the possibility of stitches. We waited for more than 3 hours and gave up in order not to wait any longer. I don't understand what kind of emergency service is. It was an open wound. It wasn't headache or an upset stomach. A wound that might become infected. We were there at 11:30 p.m. and it was around 2:30 a.m. and we were still waiting. Most of those came after us are gone. Staff and service is extremely poor quality and uninterested. I do not recommend at all. Only a waste of time. A year ago, the worst. Some of the staff here don't know how to treat people. My auntie was going into labor and she was in pain. When she gets here, they couldn't give her a wheelchair to get to her floor. She had to walk up to the elevator. I have a lot of complaints, but y'all really ain't it. 1 star, but in reality, y'all deserve 0 star. Worst place on earth. I waited 6 hours to be seen. I was with my daughter, 10 years old. I begged the guy at the door to give me my x ray results, and he couldn't tell me when I was going to see them. I had to leave because my daughter needed to eat. I have health insurance, and the one time I was in need of help, they didn't come through. People were throwing up in the waiting area, and it took a half an hour for someone to show up and clean it. I never saw that the cleaning person applied any cleaning products to the floor, it was just mopped. I only went there because it is the nearest emergency room in Fort Lauderdale that was open. One lady came into the emergency room at 6. She said she needed help and repeated, "I'm going to die," almost the whole time. They said they had a bed getting ready for her, but she was there till 11:30. But overall, their staff were pretty nice. This is a common one. I hate this hospital. They lost my belongings and they could not find it. I asked for something to eat and drink, but they don't care. This hospital need to be in the trash. Include a photo. Yeah, a lot of people saying no food and drink, and also that they lose their stuff. Okay, so 2 years ago, horrible, horrible care facility. Despite all details given to nurses and doctors when admitting my mom on Tuesday due to a minor fall that she cannot tolerate any pain medication beyond just Tylenol as needed, the night doctor gave her not one but 2 doses of oxycodone throughout the night, which left her extremely nauseous and vomiting all day yesterday and left her too weak for me to be able to take her home. But instead has to stay another horrible night in that awful facility. The nurses on staff are horrible, and everyone points fingers at anyone else, and no one can tell me how this could have happened or who is responsible. I was there all day when they admitted her and all day yesterday, but who is supposed to care for your loved ones during the night? Yeah. Year ago. Took my 2-year-old daughter here late at night, 12/10/21, because she had an uncontrollable cough. Waited for hours for them to just do an x-ray. No swabs or any other testing done. Was told it was just a cold/cough. Ended up taking her to Plantation General Hospital 12/14/21. They tested for everything, and my daughter has RSV, respiratory virus that could end up deadly for kids if left untreated. Broward General has really gone downhill in the past few years. I will never return to this hospital. 2 years ago, this hospital is terrible. If it weren't so inappropriate, I would be cursing while writing this. You would think that checking in would be the simplest thing to do, but these people are so far from organized, it's insane. The security guard and outpatient has the smartest, most disrespectful mouth I've ever seen someone display while working. My issue with her was just the way I was spoken to and dealt with, but also the way she was speaking to other people. I will literally never drive 2 hours away again for this place. A year ago, I had to have a COVID test on Saturday in preparation for a pulmonary lung function test on Monday. My appointment was for 12. It was my first time there. When I got there, the receptionist said there were no more COVID tests. I said, but I have a 12 o'clock appointment. She said, but it's 12:04. Really? Could the lady doing the test really have left at 12? Also, no one told me that I had to be there exactly at 12. I could see if I was really late. So the receptionist said I could come early on Monday to do the COVID test, before my pulmonary function test. Really? I had already originally asked if I could do that in the first place, so I wouldn't have to come 2 separate days. So I'll probably have to travel 18 miles again and maybe a third time since I will probably not be able to do both the same day. What a terrible way to run a medical center. I have lost faith in Broward General Medical Center. 2 years ago, I had a very bad experience here with the doctors. Not only did my primary doctor Warner completely disregard me the 2 times he came to check for a period of 5 seconds, he threw his hand up and continued to walk away as I asked about the health issues with my DVT in my chest, trying to seek more assistance and knowledge out of it. By the end of my stay, I had one blood doctor telling me he wanted to hold me for 4 more days, Dr. Warner not responding to any of the nurses, and then surgeons telling me, don't come back here in case of emergency, we won't be able to help you. The only one I appreciated was the friendly nurse, thankfully, and the other doctor who was shadowing, who fought for me and helped inform me on knowledge. It's sad to be in a hospital for any reason and then to be treated in a disrespectful and rude behavior and pushed to the side is disheartening that these are the professionals they employ here. Let's not forget to mention I had multiple screenings they listed that I was not informed of or even had performed. This hospital should be ashamed of itself, especially being a teaching hospital that directs new doctors entering their profession. All right, 2 years ago, the worst hospital experience I have ever had. The staff was hateful, unorganized, would not listen, lied about the answers I gave at admission, wouldn't update my meds from 3 years ago, and kept me from having emergency surgery. The hospital discharged me while I was in pre op waiting for surgery for 3 hours. They gave no reason to me or my doctor and forced him to draft discharge orders. 2 years ago. I just recently moved to the state of Florida and my boyfriend had to have an emergency surgery yesterday evening. I left him after the procedure for an hour to get him some clean cloths. Came back, found him crying in pain, saying he's been pressing the button for the nurse after he woke up and no one came. And one of them came and yelled at him to stop pressing it so much. My boyfriend does not speak English. He was in relief to see me. Shame on the nurses of this hospital. Your job is to make the patient feel comfortable. Disgusting, really. I was seen in the emergency room 1/1/2021. Dr. Van Smith and nurse was excellent, but the charge head nurse was highly rude and unprofessional and informed me yesterday my prescription was completed. Called today 1/2/2021 to speak to her, and of course I am upset due to the fact I called numerous times and received no call back. Finally got through to her as I requested to speak to someone over she hung up. I work in the healthcare industry and I've never dealt with someone so rude and unprofessional in my life. I don't care how aggravated or rude I was. A patient, I have every right when I was as a patient, I have every right when I was told from her that it was done yesterday. I do not appreciate that. I will make sure to not ever go back to this hospital ever again. One bad apple, all is a bad apple. Don't you ever hang up on me ever again. To make sure that she is held accountable for actions, I will keep calling to request a supervisor over her. That's not right at all and so disappointed. 2 years ago. God help any of us who needs to speak with someone in the billing department. After trying to speak to someone in billing in person, I was told by security I needed an appointment and handed a slip with the number to call. Well, I've called for 2 weeks, put on hold, and had the option of emailing them or leave my number to be called back in 24 hours. I've heard nothing back either way in over a week. I need certain certification forms for a hospital policy from work, and nobody will do their job by calling me back or emailing me back. I'm at a catch-22 and getting no help. Absolutely pathetic. A year ago. When you finally get in to see someone, they are lovely. If you want to schedule anything at their diagnostic or imaging centers, go somewhere else. They need to hire more people. Listening to the phone tree for 30 minutes and pressing multiple buttons to wind up at a number with no voicemail or getting hung up on several times is frustrating and a complete waste of everyone's valuable time. Get it together, Broward Health. 2 years ago, I went in for bleeding out for 3 months. The doctor questioned everything I told her. She stated what I told her can't be, then had all these tests done that took hours. And instead of her telling me, she sends in a nurse who says, "We can't find what's wrong with you," then hands me discharge papers. The rest of the staff was nice, but the doctor made me feel like she didn't want to do the job at the moment. A year ago. First, Broward Health forced my primary physician out of BH because she wasn't seeing enough patients. Then BH had a security breach of my personal medical information. Now my supplemental insurance has been dropped by BH. As a consumer, this organization appears to be grossly mismanaged. 2 years ago. Horrible bedside manner for COVID-19 positive patients. Please do not come here if you are COVID-19 positive. The triage lady was insanely rude and said we were wasting our time. That shortness of breath is a symptom of COVID-19. When a quick Google search shows that when you have to go to the ER, I wish I knew her name. Skinny, older, redhead, white woman. These people clearly do not care. Then the woman that did my EKGs started yelling at the guy that took me back in Spanish, saying that COVID positive people can't get EKGs because it contaminates the room. Instead, sanitizing it like any other room. Awful place. I had no idea a medical facility and its doctors could be so lousy. Pathetic. They ignored us, mismanaged care, and my wife died under mysterious circumstances. Their whole care is based on legally getting away with negligence. If you need help or your life is on the line, you are better off in the gutter than this sordid place. Jeez. My wife died under mysterious circumstances. This is the one Google review this man has ever left. 2 years ago. This hospital is going to allow nursing students to bring all their germs from the outside world into the rooms of our loved ones. This is not the time to allow students who aren't licensed and unnecessary personnel into the hospital. We're in the middle of a pandemic and you want to allow students to risk their lives. Of course, only a hospital with such low standards would allow something like this to occur. Why aren't any of the other hospital systems allowing students in? It must be for a reason. So, why would you allow something like this to happen? I'll be making a report with the Joint Commission as well. I believe this is something that needs to be looked into. All right, a year ago. I have asthma and was suffering with COVID 19. I contacted this establishment and was told that I would qualify for monoclonal antibody IV treatment. They told me I had to have my doctor's office fill out a form and a script, in which they did. They sent it to the fax on the paperwork, which were the instructions. My doctor's office tried for 2 days and the fax never went through. I called and tried to plead with this establishment, asking them if they would please take the script via email because the fax was not going through. Per the manager on December 28, 2021, they could not accept the script via email. I could have died. I know the treatment is free, and I told them that I did not have insurance, so I did not want to go to the ER. Nevertheless, they should have treated it as a dire situation. I worry for other people in this situation and hope that they are more willing to work with patients in need. This was really disgraceful, and the manager's owner should be ashamed. 2 years ago. This is the absolute worst hospital I've ever been in. I came in for hip surgery. I laid in a bed for 2 days and they discharged me without doing anything. They wanted me to walk out with a broken hip and fractured foot. Could not speak to my attending doctor, and I got the runaround when I tried to speak to anyone. 2 years ago. One of the worst hospital stays I've ever been. I'm not sure if they are understaffed, but had to wait an hour before seeing someone, and the ER room was empty. They couldn't do anything for me, driving to Boca Regional Hospital. 2 years ago, when would you expect an emergency room to turn away someone exposed to COVID with many classic symptoms but not in distress, and he's asking for a COVID rapid test? Shocking. I was turned away today and told that unless I was to be admitted, they aren't offering testing to me, but to search for an urgent care. 2 years ago. I hate coming here for this to be the main hospital in Broward. You guys are understaffed, overwhelmed with patients, and no room to place them. Try keeping Fast Track open till 12 a.m., using some money to make a bigger facility, and maybe find a way to separate critical patients from non-critical in separate buildings, separate wings of hospital. Trust me, your staff and patients will greatly appreciate it. 2 years ago. Absolutely minus 100, ... Upsetting, unexpected, and unexplainable. I just observed several key personnel come into work the beginning of their shifts entering from the outside of the facility, not wearing a mask, and after being verbally challenged by the receptionist that they needed to have a mask, continued walking into the facility. Yes, I am very upset. This was a security person and what appeared to be a medical person. So I call HR, and after explaining my concerns, she blindly transferred the call to customer service. Is this newsworthy? This is horrible. 2 years ago. Worst experience I've ever had in an ER ever. There was a clear disregard to my concerns of pain and discomfort. I can see through the blood pressure and heart monitor facade of care. No testing, no concern. 2 years ago. My experience with the front desk staff was awful. They give out flyers with incorrect visiting hours and are extremely rude. Don't go to this hospital if you don't absolutely have to. 2 years ago. I wish I could give this place a minus 50 out of 5. Front desk rude. Inpatient nurses rude. Also, they talk over you and don't even listen. I had to explain myself 5 times for one of the nurses to even half understand what I was saying. 2 years ago. Not a place for emergencies involving pain. I sat 8.5 hours and received no pain medicine, not even in prescription. Just got antacids that didn't do a damn thing. I'm still in pain. I recommend any Memorial Regional Hospital over them. I don't know how I'm going to get through the night. I can't eat without crying about it. Stay away if you are in pain. I'm warning you. 2 years ago, probably the worst hospital I've ever been to. The ER docs are extremely rude. Everything always takes forever. I've had blood on my bed, either on the sheets or on the handrails. Just an extremely disgusting hospital. 2 years ago, terrible service. My husband did an EEG and the report was very late and he got it 10 days after he did it. The doctor did the report, took 10 days to review the study. 2 years ago. I'm really sick and was submitted to the ER and everyone was super mean, rude, and combative. Not to mention they were all overweight. You can't be mean and fat. You have to pick one. You can't be both. 2 years ago. Okay, for minor trauma, but malpractice is a daily issue and they have mistreated me twice with potentially fatal results, even with complete medical history available. Don't take your dog. 2 years ago. The outpatient clinic is very inconsistent and doesn't respect the patient's time. Communication is very poor. 2 years ago. Worst hospital ever, rude nurses, dirty inside, smells weird, very bad energy. You might as well stay home. 2 years ago. Terrible hospital. Do not go there unless you're already dead, because then you won't know how terrible they treat you. 2 years ago. Worst hospital, may sue them for negligence, pain, and suffering. 2 years ago. This hospital is a nightmare. Avoid at all costs. 2 years ago. Worst place ever. Don't go here. 2 years ago. Doctors don't seem to have a clue. All right, that concludes the the reviews from Broward Health Medical Center. Next, we have Florida Medical Center on West Oakland Park Boulevard in Fort Lauderdale. 3 months ago, these people are literally killing my mom. My mom never had anything heavier than Tylenol. She was talking on the phone and everything they started giving her methadone. After the second dose, she never spoken word again. So now she can't even answer her phone or wake up. I called and asked several times for them not to give it to her methadone. I can understand her life coach being over her medication, but not her proxy. Her life coach didn't know her no longer than 2 weeks. I live out of town. Even the life coach handed me her bank card and handicap sticker, went back to her apartment. All her food and important papers are gone, and a lot of other stuff included.
These people gave my mom's life coach proxy over her. So even when my mom passes, she will be contacted. Lucretia will be contacted and not me, her daughter.
Jeez. Here's another one. Same thing, or?
So this is where my mom is. Florida Medical Center, a campus of North Shore. She's been in here 7 days today. The day she came in here, my mom never had more than a Tylenol. They put her on methadone. She's still here in hospice on methadone 7 days later.
That is terrible. All right, a month ago, it's a shame you can't go lower than 1 star. I would not recommend this place to your worst enemy. The staff, with exception of maybe 3 nurses, were at the absolute worst. Their favorite words regurgitated amongst each other. It's not my problem. The doctors have to be amongst the worst, and this has to be the only place they can find work. Went in for bladder stones and found that I had developed an infection in my pancreas. The pain was excruciating. Was in that hellhole begging for pain medication for 5 days. Would get them every 4 hours and would last 1.5 maybe. Did not eat or nearly slept. Every time I asked for the doctor, the nurses would tell me they would call him, but never did, or tell me that the doctor would get mad and yell at them for bothering him. On the 5th day, once the infection went down, they discharged me without removing me or making plans to remove my gallbladder, which mean that this will occur again. Got home, my wife went to pick up my medicine, and the doctor purposely left out his DEA number and other information, preventing me from receiving it. When we called the hospital to explain this, the head nurse said that I was discharged and that it wasn't their problem. It was only until we threatened with patient abandonment that they corrected the issue. I bet a lot of people died here during COVID. If you loved your family, friends, or anyone you know, stay as far as you can to this place. One last thing, they gave me my last medication, and while medicated, the nurse gave me papers of discharge, and I had to literally walk out of the hospital while in a medicated state. No wheelchair. Week after the entire ordeal. 5 months ago. This is by far the worst hospital ever, and I mean that with a disgusted passion. If you love your loved ones, avoid them at all costs, as they might not make it out of this hospital alive. The service was horrible. Nurses did not want to explain nothing to you. All they do is give attitude. No updates given on your loved ones. The case manager was of no help. The person who actually runs the whole hospital is worst. He has no empathy whatsoever, so explain why the staff behave how they do. One doctor gave me misleading information to put my loved one in hospice, which I had to revoke their rights when I realized what was taking place. The day before my loved one was to be transferred, they sedated them. I strongly believe it's because of the insurance the hospital claims. My loved one developed stage 4 bed sore. I witnessed another family bringing their loved one in for something minor, only to have their loved one die after 3 weeks in their care. This place is death and horror house and should be shut down by the state. A month ago. Not a lot going on, plenty of staff doing nothing but walking around. A person came in with a headache after head injury, get a scan, all that needs to be done is read. Why would it take 5 hours to get a result and discharge to follow up if a headache persistent? Horrible ER. 3 months ago. Please don't leave your family members alone here. They'll put them on methadone, so their heart will slow down and die, even when you ask them not to. We were told if she sleeps too much on it that they wouldn't give it to her no more. They're refusing to not stop giving it to her, even though I'm her proxy, power of attorney. And multiple messages for Dr. Mendez to call every time he comes in the room and refused to call me or respond to my calls. Jeez. Methadone problem is intense here. A year ago, dirtiest hospital ever. Saw a cleaning lady in the bathroom, but she switched out the trash and never returned to the ER. Been here for 4 to 5 hours and it's been like this the entire time. Let's see. Rags on the floor. Damn. Yeah, it's not what you expect in a hospital. It looks like it's like a gas station bathroom, really. So many photos, so much detail. Gotta see it all. I don't know really what this is supposed to illustrate. Just that it's shitty. Oh, there's a bag of chips. It's nasty. I wouldn't like that. Yeah. 5 months ago. This hospital is not adequately equipped to take care for patients or rehabilitate them in any capacity. This is not personal, but it is fact that can be proven. This hospital is negligent towards its patient care along with providing inclusive care with the family. Overnight, the hospital staff are extremely unconcerned in the care they provide, overlooking physician orders, lack of physician orders, not assessing patients in accordance to their diagnosis parameters. The physician staff only have their best interests in mind by using patients as experiments to better equip their medical skills that they lack in, having an unnecessary amount of surgeries that is not pertinent to patients, making decisions with family acknowledgement. In addition, this hospital is partnered with Vita's Hospice, so therefore, if money can be made, it shall with every patient that is admitted into the hospital. Florida Medical Center is not proactive, innovative, and restorative in patient care from admission to death/discharge. 7 months ago. If I could give a negative start, I would. My boyfriend randomly started having seizures in August 2022. He has had 8 and 9 months. The discharge papers have no info, no results of testing, nothing. Today he was released after 6 hours of being there with no testing done last night. Was brought in by ambulance after having 2 grand mal seizures at home. He was discharged. I came to pick him up. He was on a bench vomiting and couldn't walk. As I got him to my car, he was still covered in blood from the wounds from the seizures, still open, not cleaned, not even a band-aid. The cut on his back from glass looks like it needs stitches. In the discharge papers, we were told to follow it up with Dr. Wiley with no contact info to make an appointment. I called, asked nicely if I can have the contact info so we make sure it is the same doctor he saw today. I was told to find the doctor myself. We do not provide doctor info. Shut this hospital down. Do not trust your loved one with these monsters. 4 months ago, staff in the ER appear to be non-caring towards patients no matter what they come in for. My daughter came to the ER for severe chest problems and they had her on a bed in the hallway with nothing hooked up to her chest to monitor it, for no one came to assess her periodically during her stay. I could go on and on of all the reasons I have about the ER experience. Don't go there if you want to live. 7 months ago. If I could leave 0 stars, I would. The lack of patient care is disgusting, the lack of care, period. Not once nurse introduced themselves when coming in the room. The laziness of the nurses showed last night will forever haunt me. The nurse drew blood for labs and left the blood tubes in my room. Never sent it over, stuck an IV in my arm, and never added the saline to the port. So for 45 minutes, I'm just sitting there with an IV port in my arm attached to nothing. Oh, and then I hear they'll leave for the night. Her shift was over, and she said not one thing to me. I came in for chest pains and was treated like I was some type of animal. When I demanded to be discharged with tears coming down because I was so livid, all they did was say calm down and remove the blood from my room. Again, waited another 20 until I couldn't anymore, and I removed the pointless IV port out of my arm. There was no one in ER, literally 3 patients, with 8 nurses talking and not caring. Wasted 3 hours of my life for nothing to just go to another hospital. I seriously don't understand how that place is even open. I would rather die in the streets than to ever step foot at that hospital. And the horrendous nurse name was Lovely. Wish there was somewhere I could report her. Honestly, everyone during that night shift was horrible. No on. 6 months ago. Stay away from the hospital. Had me here for 3 days. The treatment from the nurses are horrible. Felt like I was in my bed rotting, being ignored. I discharged myself and went Broward General for my issue and was only there for 2 hours, and I feel way better. Don't come here. Don't bring a loved one here. Nothing. It's interesting to hear somebody directly compare it to Broward. If I could give negative numbers, I would. Stay away from this place. It's dirty, nurses don't care, and they're all nasty and rude. They administered Love Knox medication in the arm against the abdomen. RN wears rings and bangles and long braids, no infection control. They only wanted to discharge her ASAP to a SNF. If I don't get her out of there, they will surely kill her. Please read my words and stay away. Florida Medical Center really needs to do better. I never liked this hospital, but my parents go here because it's a heart hospital and it's close. But after last night, all that has changed. It took them 2 hours to bring my mom a simple cup of water. The nurse Olivia was the only good thing that happened last night. She was so helpful. The bathroom was so nasty. My mom came in for numbness and arm and pressure was up. She got there at 5:30, didn't leave until 1 a.m. Glad they didn't find anything, but it was a man in the waiting area slumped over in pain and no one helped him or even came to see about the man. I did help with his paperwork. It's just so sad that people don't care anymore. I would never send anyone to this hospital. 4 months ago. This is the worst place to come to when you're sick. I'm here now and it's a horrible experience that I will make sure everyone I know will be aware of after I leave here. I will rather die of a stroke or heart attack right now than continue with what I am going through. Useless and not worth it. We'll be filing a complaint ASAP. A year ago. They are horrible. My mother went in for chest pains. The doctor called me advising that she had to have emergency heart surgery for a torn heart valve. She had the surgery. She was in ICU for 2 weeks and they had just discharged her. I advised that she still needs assistance. This was a big procedure. She needed more time to heal and monitor. The doctor said she will be fine because she walked down the hall of the hospital. And they said they would assign her someone to visit 2 times a week. My mother was discharged Friday, August 5th, 2022, and I found her passed away Sunday, August 7th, 2022. I hate this hospital. How can you go from ICU to discharge a patient in 2 weeks from heart surgery? They do not care, have no compassion, and still have not advised the cause of death. This morgue they call a hospital needs to be shut down ASAP. And they actually responded to this one. Thank you for taking the time to leave a review. We are very sorry for your loss and ask that you send us your contact information so someone may reach out to you to discuss the experience. Your contact information can be sent to patient relations. 6 months ago. One of the most disgusting hospitals in the state of Florida. How this hospital is still in operation is beyond me. When I went to visit my friend who had an AF ablation procedure, everyone from the nurses were rude down to the dirtiness of the hospital rooms and bathrooms. I felt like I was in a third world country. If you're getting any procedures or surgeries at this hospital, stay away. 9 months ago. Brought my 86-year-old grandmother here at 12:30 p.m. and she's a diabetic and no food or fluids given. We haven't seen the doctor in 5+ hours. She said she had to go to the restroom, and the nurse I asked to get a bedpan was not the most pleasant. The doctor come in as I am typing this and basically saying he is busy. It's only one of him, and my grandma condition is not as dire as the others, yet are talking about keeping her and running more tests. Nah, we are leaving. 8 months ago. My dad went to this ER due to COVID. He was there for 23 hours without any treatment or food. He was starving then. A nurse noticed his heart rate was high, so they sent him to the ICU. They sedated him heavily and strapped him to the bed. He couldn't move. I went to visit him in the morning, and when we got there, a nurse who was supposedly to be watching him was on his phone while the machine in his room is beeping and blinking red. No one noticed that this rate had dropped to 47. The nurse, Adriano, hardly speak English, and he could hardly understand when we speak. When we inquire why his heart rate is so low, that's when the APRN and the doctor rush in because my dad was unresponsive. He was oversedated. Nobody knew what was going on. Their response is, they think, they should know. He has been in the ICU for 5 days and has contracted pneumonia and has 3 bed sores. They didn't feed him because he was hungry. His mouth was dry and parched as they were giving him medicine through the tubes in his nose, but no food for over 24 hours. They didn't clean him or brush his teeth. They neglected my dad. I realize that these people have no compassion, especially when they are old. This is the worst hospital I've ever seen where no one really cares about the sick. They lied about the bed sores. That is one small one. But them to find out it is stage 3, they call for a family member to come as they want to do a CT scan with contrast. They are covering up something. Last Monday, they said they would get the nutritionist, and 6 days later, still no nutritionist come to see him as he was difficulty swallowing because nothing has wet his mouth or throat. Only a miracle can save my dad now. Only a miracle. I've heard that the hospital is called a cemetery because people die there once they go in. How can a patient develop bed sores in a week? I just can't fathom it. Please don't take your loved ones to this hospital. Elsewhere is better. Even home would be better. 7 months ago. I was the caregiver of my relative when he was admitted to Florida Medical Center. He suffered from cognitive decline, thus I was his healthcare surrogate. I arranged for him to be discharged to an assisted living facility. FMC did not contact me before sending him out of its hospital. FMC sent him to the assisted living facility with only a hospital gown. FMC did not contact me and give me a chance to bring him clothes. It was a terrible experience. The assisted living facility called to inform me that he was arrived with only a hospital gown. FMC could have done better. 8 months ago. Extremely rude. As soon as I got here, I can barely breathe, and the so-called nurse said I'm fine. Waited 2 hours to even get noticed, and another 3 hours in the back just to get sent home. Multiple patients in hallway and completely unprofessional. If you wish to die, bring your family here. They will allow it. 8 months ago. The only thing about this place was a few caring and actually knowledgeable nurses on my dad's neuro ICU floor. His surgeon, Dr. Okun, was great, but communication at this hospital is awful. Terrible. The internal medicine, Dr. Abdu, is not the best. Did I mention communication is awful? Hardly anyone speaks or understands English, or they are very hard to understand. It took forever to get anyone to call you back with answers or maybe an update if they called back. I called several times and left messages to speak with the director about the issue of no one calling with updates or giving me answers to questions. Never received a phone call back. I would prefer to take my dad elsewhere except for his neurosurgeon, whom we greatly appreciate. A year ago, my niece went to this hospital via rescue. The lack of care that she received was totally unacceptable. After being there for 45 minutes, I had to call on the phone to ask the nurse to check for lung sounds. After verifying that she was wheezing, she still did not receive a treatment. I called back to find out why she was not receiving a treatment. I was told by Tawanda, the nurse, that it was because another patient was being intubated. So I asked if someone is in respiratory distress. There's only one person in the hospital to administer a treatment. I was told yes. I left work to get my niece out of that place. Don't ever go to this hospital. The nurse manager was also very cold and arrogant, and they responded. We would like to share your niece's experience with the emergency department. 10 months ago. I went to the ER in April and was disappointed with the nurse taking my vitals. She used the blood pressure cuff that was previously used on other patients. When I suggested using a liner or a new one, she refused. I was too sick to fight. On 11/6, I had to go to the ER again. I am a cancer patient receiving chemo, so I'm careful with my health. Overall, the nurses attending to me were great. My bad experience was with the CNA. She was rude to the point that I swore that I'd rather die than go back in there. She came to draw labs from a saline lock with fluid infusing. I asked her to do a vein draw. She refused. I told her that it would not be accurate. She continued to flush with 5 cc, then waste about 3 cc of blood. We ended up arguing when she told me that if I was in medical, my method is outdated. When she was done, she told me that she has proven that medical professionals are the worst patients. Immediately, the attending doctor came and discharged me. I mentioned the incident to him, and he said that he heard about it. No one would ever give her name, so I could make a proper report. 2 months ago. Worst hospital ever. I recommend that you go somewhere else immediately. You will be waiting for a room or hallway for 4 hours. When they do call your name, it's another 4 hours waiting for a doctor. When you ask for assistance, they forgot about you for another 2 hours because they are too busy sitting there chatting with each other. If I didn't have a broken right foot, I would have walked off, which is what everyone does when they're forgotten to 10 to 12 hours. That's a different email here. Wait, this is response 5 years ago, but this review is 2 months ago. All right, 2 years ago. If I could give this place 0 stars, I would. This hospital is terrible. If you ever come to this place, turn around now. My father was admitted to the hospital since his sugar was low and he had high blood pressure. He had blacked out and fainted. The staff was horrible. The unit secretary was rude and not helpful at all. She told us to call back in 45 minutes for an update, and when we did, she was not compassionate and tried to brush my mother and I off, stating that COVID patients are a priority and the nurses are busy with other patients, so we need to calm down. She then, mid-sentence of us speaking with her, transferred us to someone else, which was another nurse who seemed agitated, and then hung up on us because we were concerned about my dad. To get a call saying he's discharged, which we were happy about, because Florida Medical is known for being a horrible hospital, so we wanted him out of that place. The unit secretary lied and said she spoke with the doctor and said he don't know what's going on, but he's getting discharged. They left my dad outside by himself, still weak and not orientated. They said my dad had someone out there with him and that security and staff was outside, which no one was. And when we came to the hospital, my dad was outside on the ground alone. He had fell and hit his head on the trash can and had to be admitted to this hellhole again. The PM triage nurse called police on my mom and I, said nasty comments to us. He was not helpful, and the other nurses lied and left my dad for dead. The nurses had no compassion. Terrible hospital. Never again. The ER nurse needs to be fired. He called the police on several patients the whole time, and Mom and I stood out there. Left the outside for hours. A year ago. Some of the staff was very helpful, however. 2 major issues occurred that were very scary. My family member was to receive nebulizer breathing treatments every 6 hours, but it was entered as needed. At 11 p.m., it was entered as needed. At 11 p.m. at night, she was given a treatment, not her first, that burned her throat and esophagus while breathing it in. When she told the respiratory this, she was told it was due to her throat being sore from coughing, which was not the case. Then, for some reason, she came back 1 hour later and have her another breathing treatment that didn't cause any pain. When the nurse was questioned about it the next day, there was no record of the 11 p.m. treatment, only the 12 a.m. treatment that had been documented. When my aunt was discharged and sent to a skilled nursing facility, I asked to see the list of medications that was sent to them by the hospital. When I reviewed it, the medication that was given to her to control her heart and blood pressure, which is why she went into the hospital, it was listed as discontinued and it should not have been discontinued. I contacted Florida Medical Center immediately. My aunt missed 4 doses of this medication before the hospital was able to correct the issue with this skilled nursing facility. Her heart rate is very high again now, and we're waiting for this medication to get back into her system to bring her heart rate down. This error could have been fatal if I hadn't reviewed her medication list and known she was supposed to be taking. Very unhappy with this facility. A year ago. Don't ever go here. 33 weeks pregnant, came in for shortness of breath and body pain. They took an hour to check me in. I took a COVID test at 1. Ain't get my results back till 6, and it's supposed to be a rapid test. I was never put in isolation. I was left in a hall for others to get contaminated too. Very, very, very unprofessional. 2 years ago. If you have a family member that has any type of behavioral health issue, do not send them here. I had a relative who was Baker acted here, and they did not ensure that she received the proper care she needed to be stable. She was discharged and nobody notified our family of her release. She managed to run away from the facility her first night there, and we had police at our door at 1:30 in the morning to tell us that they could not find her. Nobody contacted us or discussed her discharge plan with us, although we were promised that they would. When she returned home, her clothes smelled like she was sleeping on the street, and she was in the same confused, paranoid, and disoriented state she was in when she was admitted. We are very disappointed in the care or lack thereof of this hospital and its staff. They were very incompetent and lacked professionalism. My sister did not receive the care that she deserved. So basically committed. 2 years ago. Please do not go to this hospital. Spent almost 2 weeks in their care. The hospital staff that I came in contact with needs more training on how to be more compassionate. Quality of care was at a bare minimum. Most staff was not equipped to deal with the sick, left unattended 90% of the time. It's not given the care or medicine needed to make it more speedy recovery. Communication was at a minimum, non-English. Most of the staff seems as though they hated their job. Luckily, I had a family that checked on me daily. FMC, you all need to do better, please. A year ago. Worst hospitals ever. They're very slow. If you have emergency/urgent, do not come here. I've been in this hospital since 9 a.m. They still haven't called me even at 2 o'clock. They're very unorganized. They keep saying that they're taking people with high priority, and I had abdominal pain. They don't know what they're doing here. If you want to be seen urgently, do not come here. A year ago, my worst experience ever. I told them that I had ancillary conditions that prevented me from staying a long time without showering. They ignored me. They put nylon socks on me despite me telling them that I was allergic to most synthetic materials. I was tortured and had to escape. It was that bad. A year ago, if only I could give 0 star. My young adult son was Baker Act and sent to this hospital. He stayed 5 days. They gave him a program daily activity list, which didn't exist. They did nothing but sleep, eat, and watch television. He didn't get counseling. The doctor was not passionate. She was very sarcastic, rude, and bothered. If you asked her a question, it was as if you were bothering her. The staff was very friendly. The visiting television room was not clean. This place is not the best for any mental patient. It will put you in a deeper depression. A year ago, I went to the ER department. I was to do a CT scan. The radiologist was very rude, unkind, and unpleasant. Her words were very mean towards me. Too much to write. In pushing me out the door, I was told by the nurse that the ER was for emergency and not for chronic issues. Feel better, ma'am. And B, I did not go there for any chronic issues. I do have my PCP. The rude manner in which I was dealt with was not taken very well. I do hope that these representatives of FMC will treat others much better than they have treated me. Thanks to the others who did not make my experience so bad. Thank you. 2 years ago. The staff is horrible and mean. The CNA are the most uncaring. The traveling nurses are good. Others overtalk you and do not listen. One staff member told me, go back in my mother's room and stay there, as if I was a dog. I went to tell them her hands and feet were blue. By the time they came in, they were in a panic. No one listens. Horrible experience. Released 11 a.m. only to end up in another hospital 18 hours later. Fluid in lungs, etc. Do not take your loved one there. Remini likes. A year ago, worst hospital ever, very unprofessional. The nurses clearly chose the wrong career path because they all seem to hate their jobs, and the hospital has heroes work here all over the building. Well, none of these so-called heroes understand the assignment of being a hero because they all act like they don't want to do their job and you're bothering them by asking them to do their job. And most definitely never Baker act someone in this hospital. Even if you need something as simple as drawing blood, don't go here. 2 years ago. Awful place. The reviews don't surprise me. They don't let you come in the ER to see your loved ones, even though on the automated machine, when you call the hospital, it says they are now accepting visitors. Nurse Michelle, that works the ER, was so rude and had absolutely no empathy to me on the phone as I was trying to find an update on my husband who was in a car accident. They don't even let you inside the lobby. Hope the tables never turn on them trying to see a loved one. A year ago. This is the most unprofessional hospital ever. Family member was brought in. They don't give you any information. The receptionist, Sonia, who answered the phone in ER, needs a lesson in phone etiquette. When you have family who had a seizure and fell on the floor, don't bring them here because they will only do blood work and give an IV. They give you a phone number to call and check on your family, and the staff acting like you aggravating them because you want to know what's going on with your family member. This hospital needs some help. If the staff don't want to work in the profession they have chosen, why be unprofessional to the people that came for help a year ago? This hospital is very unprofessional. They do not care about your loved ones at all. I have never been treated so poorly by a place that is supposed to provide healthcare in my life. My boyfriend is a patient there and they won't feed him. The unit he is staying on is beyond disgusting. You can tell they take no pride in upkeeping the hospital. There was food and juice stuck to the chairs in the visitation room, roaches walking on the walls, old blood spatter on the tables. I am in shock this place is operating, and the staff is embarrassingly rude. I have been insulted, hung up on, and just ignored. I will be filing a complaint with the Department of Health. A year ago. First of all, I went at 7:30 p.m., waited outside in the freezing cold for over 7 hours, waiting to see a doctor. When I expressed how cold outside was waiting to see the doctor, the nurse said, "Welcome to the COVID era." I'm not aware of any other hospitals that leave their patients outside in the cold. Registration and all vitals are taken outside in the cold of night. They don't seem to be in a hurry to do anything here. Your best bet is going somewhere else. Don't get me wrong, some of the doctors and nurses really nice, just someone needs to rethink their process when it comes to patients waiting outside in the elements. 2 years ago. I wish I could give a better review, but the bedside manner was bad, and I was seen after a car accident, which later showed scans from a different doctor of having injuries. When I was at this hospital, though, they did no scans and did nothing and said I was fine. Nurse was rude too. A year ago. Horrible service. Even the nurse told me they were short-staffed. I requested to see a nurse for my dad, and I was told to go inside his room and press the button. I did and waited for 15 minutes and no one came in. I noticed that the nurse button was not connected. My dad was transferred to a skilled nursing facility where they found bed sores. Caution. A year ago. This facility has many conflicts of interest. There is no diversity in the psychiatric facility east and west. Employees date other employees, so it makes it difficult, almost impossible for anyone to make decisions. I called Broward County Sheriff many times. Any officers shown up. 911 operators were pretty much saying officers were coming and never shown up. This facility needs to be investigated. Mental health techs such as Colleen and Nurse Michelle and other manipulate the unit. Colleen would call patients' names so that according to the DSM-V, patients were diagnosed auditory delusions. Mental health male techs, except Patrick, abuse patients. It's my assumption based on factual evidence that the staff is not legally prepared to handle patient with mental illness. It's a shame and embarrassing the way patients are treated at this facility. Recently, there was a hack and all staff is writing things manually, which make it difficult for treatment tracking. I don't know if the hack has been known public, but the CEO needs to respond questions. In addition, there's no professionalism at all. All techs except Patrick say, "I am the boss." I did not know a mental health facility was a punishment place, not a place to heal people with emotional problems. I really don't understand what the heck is happening here. In short words, is people with no ethic or morals that use a position of power to oppress the needed ones. 2 years ago. If you could give a hospital 0 stars, this is the one. Awful, awful place. Could care less about any patient needs or care. I wouldn't bring someone here to die. This is a perfect case of no department communication. Nobody has a clue of what anybody else is doing or has done. Whether you're able to take care of yourself or not, they will put you out in the street just so you can catch an ambulance and come back the next day. Do not take anyone that you care about there. 2 years ago. To leave a comment, you have to rate them 1 star. In the emergency room last night, my nurse couldn't put the needle to withdraw blood. She left me in the room over an hour for the next shift to come in. Very unprofessional. The next nurse, I think his name was Marvin, very good on point, knew what he was doing. I could get no meds until the IV was put in. He gets 5 stars. 2 years ago. Vitas Hospice 4. My grandmother, who was with the Vitas Hospice program, was brought to FMC. She stayed for about 5 days, and the level of care they provided was so horrible, I would never recommend Vitas FMC to anyone. Whole staff was extremely lazy and unkind. Out of 10 nurses, only one nurse was good, caring, and attentive. Communication was always poor, whether it be in person or over the phone. After complaining about what was happening, all staff came rushing, asking what they could do, how could they do it better, if we needed help, etc. If you have a loved one in Vetus and or go to the Vetus Hospice floor, please know that their level of care is extremely low and may cause more harm than good. Here we go. 2 years ago. This is the worst hospital ever. Their staffs are rude as hell. They refuse to let you talk to your family member. If you calling asking questions, they get rude, and yes, they will hang up in your face. I'm surprised this establishment is still open. I haven't heard from my brother in 3 to 4 days, and they still refuse to let me talk to him and answer questions that our family needs to know. Far as I know, he could be dead. This hospital doesn't save people, it kills people. If anyone is reading this, never send your family member there, because we'll never know anything. I prefer you going to Imperial Hospital or Cleveland Clinic. 2 years ago, I went for a chronic stomach illness. I sat outside for 45 minutes with all the healthcare workers just staring at me, bawling in pain. One worker finally came up to me and told me, "Don't be exaggerative to the workers here. They will take longer to get you what you need." I finally went inside and still no help after another 30 minutes. They all looked at me howling in pain and no help. I left. Turns out I made the better choice. 2 years ago. Terrible customer service, very unprofessional and incompetent. I've called several times, and the lady that answers the phone with the accents have much attitude and keeps hanging up on me. Won't let me talk, keeps over talking me, and just rude. I asked to speak to Esther Morris, the HR director, and she transferred me to a deadline. Then when I called back asking for HR, she told me to stop calling because she has other calls coming in. Well, she did forget she's a receptionist and that's her job. These calls should be monitored and recorded for quality. I wouldn't take my dog to this hospital. No type of care, empathy, or understanding at this hospital. If you can avoid this hospital, please do. If the PBX operator is like this, I can only imagine the care you would receive. SMH. 2 years ago. I am extremely disappointed with the lack of communication. Our grandmother has been in and out of the hospital and is in an assisted living facility. We get no answers, no phone calls, and it's extremely exasperating. She is 92 years old with dementia, and you would think they would communicate with the family since she can't speak for herself or remember anything on her own. Not being able to be there for her and be her voice is so upsetting. 2 years ago, they must have forgot the words "the worst" before the name because this place is the absolute worst hospital of all Florida. We have been trying to get my brother-in-law transferred to another more competent facility, but they can't even assist with the transfer. Oh, and good luck trying to get a hold of the supervisor of case management. 2 years ago, my mother was taken to the psych unit. I have been trying to reach her, but sometimes when I call, they ask for a code. From the time of admission, no nursing staff provided me with the code. Although I'm her emergency contact and medical power of attorney, some nurses refuse to let me speak to her. Some nurses just hang up on me when I call. My grandmother also contracted hepatitis due to Florida Medical Center medication errors. Do not send your loved one here if you can. Avoid Florida Medical if you value your life. My sister is in the ICU, and I believe they didn't do everything in their right to keep her alive. The lack of communication and urgency made by the doctors should concern everyone. If my sister don't get the proper treatment and she passes, this hospital going to have to see me because I will sue. And don't try to save yourself with no bull either. Just do the right thing, please. A year ago. Hate this hospital. Never will have a family member going back there again. Nurses rude, everyone rude. Nurses in the night rude, even the sitters too. And the patient care tech rude. Was not happy with the service me and my family receive, and the doctors don't know what they're doing. Very bad hospital. It should be closed down. Worst hospital. People, please don't send your family members there. People who I know go to this hospital never come out alive. It's that bad. My dad never got treated right, and he has dementia. It's that hurtful. It was last year, November. My dad was there. The third floor night shift nurses was not nice at all, and they bring the nursing home, call the Palms, treat my dad. Worst came in the hospital, said they can help my dad. It was the worst experience ever. Florida Medical Center need to stop letting them come to the hospital, telling the family that can help them. It was very bad. All lies. Palm Center in Lauderdale Lakes is a bad nursing home. Food, everything bad there. Warning people, don't make your family go here. Your family will not come out same person. Please run. 2 years ago. Horrible is an understatement. My father is a retired pastor who suffered 6 strokes and has a heart infection. Every day he has to go to this godforsaken place to take antibiotics through an IV. Yesterday we were called by a horrible nurse who demanded we pick up my father because he had COVID. We told her per his doctor's orders he was still to go get treatment. When we went to pick him up, he was alone outside the hospital in a wheelchair. My family and I will be sending a formal complaint against the hospital for the mistreatment of my father. 2 years ago. My name is Chantel, and I am an ICU registered nurse, first year nurse, anesthesia resident. My experience at Florida Medical Center was a slap in the face. To see so much lack of compassion starting in the ED with my nurse Manta mail to the staff and physicians who took care of me. I was denied an MRI and several other interventions due to insurance purposes. FMC discriminates against their patients. I will be filing a formal complaint tomorrow morning. Discrimination, adversity in healthcare, negligence, unsafe patient practices. OSHA and Jocko will be hearing about this. A year ago, rudest nurses, careless, and as soon as they discharge you, they get security to escort you out. Terrible customer service / care. You can tell all they want is your money. Worse hospital. They act as though you are inconveniencing them when you need anything, which is quite literally their job. Terrible place that needs to hire better staff ASAP. A year ago, Florida Medical will leave you for dead. I literally bled out and ended up needing a blood transfusion because of them. Never will I go ever here again. How is this place still standing? 2 years ago, you do not want to take yourself or a family member to this hospital. They do not treat you like a human, more like a number. Nurses treat you like you are bothering them. Stay away. 2 years ago. A few weeks ago, I sadly attended a funeral of a friend who had a simple toe removal procedure. He passed away under anesthesia. Shame on Florida Medical Center. Stay away from this place. Wow, that is insane. 2 years ago. I never going to recommend this place. My mother was there for a week, and for me and my father was hell because the doctor, Oscar Mendez, never called to say how my mom was. How was my mom? And Catherine, the nurse, never tell me when I call what the doctor told about my mom. All the doctor never give me information to who I need to call. When my mom finished the antibiotics she is taking by IV, never take your loved one in that place. Now I need someone from that place to call me or email me so I can say everything we go through. 2 years ago. If you care for your loved one, please do not bring them to this place. They will die here. Florida Kill Center. Wow. A lot of people compare it to the hospital that we did reviews for right before this. Okay. So that concludes the reviews from Florida Medical Center. Next, we have Broward Health Coral Springs on Coral Hills Drive in Coral Springs. All right, let's get into it. 11 months ago, my son was brought in by EMS, and what a horrible experience from the time they came to the unprofessional and uncaring treatment of your staff and doctors in the ER. Doctor never bothered to even come in room to examine him. Brought in from having a seizure and had 3 more while in room in the ER. His O2 dropped to 62, and I went to inform someone, and they said that's nothing. His heart rate hit 212, was admitted, and most of the care there was just as bad. Found out his sodium level was critical, 116, and could have went into a coma and even death. What if it was one of their family members? Would they have gotten treated like that? Never heard anything about the CT, and they should have done an MRI of the brain to see how bad it swelled. They then raised sodium too fast and then tried to correct that. Now this could cause major problems from now on. If I was you, I definitely would go elsewhere. Also, BP was 230 over 132. Never got to see a cardiologist, neurologist, or urologist. Wow, and they have pictures of the heart rate and everything. Jeez, his O2 level. We regret your expectations were not met. A little bit of a different response. But yeah, this is in the same network as the first Broward County Health Center that we went over. This is just their Coral Springs hospital. All right, let's see. A month ago. If I could give it negative stars, I would. Never ever in my 40 years of living here have I seen and been to a hospital this terrible. My boyfriend made the mistake of coming here. He was admitted and was told he can't shower. He can only wash up because there's an issue with the shower. The AC in the room was broken, and we were told they can't fix it unless the room was cleared out, which it can't be with 2 patients inside. They just have to sit here and sweat, I guess. For days, I've been here 10 hours a day sitting at the edge of his bed because not until today, day 4, did someone offer to bring me a chair to sit in. The lack of communication amongst the staff is unreal. We've had nurses almost give him the same meds twice from the lack of communication. The nurse and doctors are rude AF. The food is disgusting. He was supposed to have a procedure done yesterday that was canceled because the staff forgot that he needed to fast for the procedure and gave him food. He has been taken to do tests that he did not need, and when he got there to do the tests, was told it was the wrong patient. The nurse missed some of the meds she was supposed to give, and all she had to say was, "Oh, I must have missed that one," like it was no big deal. They had him fasting over 15 hours for a procedure that was supposed to be done hours ago. At this point, he is going to sign himself out and go to another hospital. Wasted 4 days in this dump. Won't spend another. I do not recommend. We are sorry you feel this way. See what else we have. A year ago, with photos. Worst hospital, stay away. My husband was given sheets with bloodstains on it. Blood that was not his. The food tray was sticky and nasty to the touch. How is one to regain their appetite using this? The curtain dividing the room had stains on it, presumably stains that look like blood. Extremely unsightly, turning your head, not feeling well to see this. The nightstand was falling apart. Chips were falling off when it was touched or anything was placed on it. Simply answering the phone caused chips to fall off the nightstand. The shower head holder was broken in his bathroom. Patients are expected to shower holding the shower head. Garbage was left on the floor next to the trash can for 2 days. My husband watched the cleaning lady empty the trash can and disregard the trash on the floor. Guest relations is a joke, showed no empathy to our concerns. Jocelyn Feliz claims the food trays are supposed to be sticky. In summer, Marrero seemed bothered by my complaints. Oh, wow. We appreciate you reaching out to our CEO, who will be investigating your concerns as well. We wish you and your family the best of health, and please let us know if we may be of service. 6 months ago, under no circumstances should you use this hospital. I went on 4/26/22. They did a bunch of tests through the emergency room and I needed to be admitted, but they would not accept my insurance. They did not notify me that my insurance until after they had done the test and advised me that if I wanted to be admitted, I must sign a form accepting all financial liability for anything that happened at the hospital and agree to pay it in full because my insurance would not be accepted. I declined and went to HCA Northwest Medical Center, who did accept my insurance and was admitted and had everything done at that hospital. I complained to this hospital that they should have advised me or had something posted to let me know that my insurance would not be accepted so that I would be able to make the decision to stay or leave as I decided. That choice was taken from me, and now they are billing me for everything as out of network and expect me to pay for everything, though the work that they did was not used for anything and all the tests had to be redone at other hospital prior to my being admitted. This hospital does not care about you, only about your money, so do not use this hospital. 8 months ago. Please don't go here if you're looking for actual care. I wouldn't wish this place on my worst enemy. I went here myself recently and waited 2 hours in the ER with severe pain just to leave and go to an urgent care to actually get service. I also had a family member who went here recently just to come back home, worse than when she originally left. The communication is horrible with the staff. The service is just the worst. And it's not my problem attitude is just the icing on the cake. There used to be there used to be a time I trusted in the medical system, and now you're simple just another insurance claim. I wouldn't go here even if I was dying. Just let me meet my maker at that point. Do yourself and your loved ones a favor. Do not go to this hospital. You were warned. If you truly have to go to a hospital, Holy Cross, highly recommended. 7 months ago. Holy cow. I genuinely and highly suggest taking your loved ones to another hospital. Unless you have absolutely no alternative, the quality of care and the bedside manner from the hospital staff is significantly inadequate and combative. My grandfather came in on February 1st, and as of February 12th, has consistently received subpar patient care. My grandfather is battling aggressive prostate cancer and is currently being seen at this hospital, and every time I come to visit him, I'm without fail heartbroken to see the state he's in. Each time I've come to visit him, he's wet, cold, and laying in urine-soaked sheets and blankets due to catheter malfunctions. He's complaining of not being changed or moved or heard. I started addressing my concerns to the staff February 2nd, 2023, outside of Dr. Castellanos, who did take the time to truly hear me, and Nurse Winnie, who was the only staff to show true compassion and a standard of quality care every patient deserves. Each request for a higher standard of care is met with defensiveness. When a transfer request was made to have him moved to a surrounding hospital, Angela, a case manager, was immediately defensive and began questioning my reasonings. Gratefully, Cindy, another case manager, saw that the imbalance of the situation and stepped in. Cindy assured me she would do all she could to address my concerns and begin the transfer process. Days passed, and Cindy informed my family that every hospital had denied the transfer request. The lackluster care continued, and the overall experience unfortunately worsened with time. My mother, who lives in North Carolina, and my aunt, who lives in Georgia, both had to take off from work and fly in to assist me with advocating for my grandfather. This seemed to make matters worse. Karen, the patient care assistant on the third floor surgical, was the least sympathetic and most unprofessional of all, and ultimately led to this review and the formal complaint I'll be drafting and submitting. Karen took each concern brought to her attention as a personal attack. When I asked her for a nurse or a doctor to give me an update on his treatment plan, she told me to ask my grandfather. He can talk. I informed her that it wasn't his responsibility to update me on matters that he was too sick to fully grasp, and that I had asked him as much as I could, but still had many questions he didn't know the answer to. At this point, she said she'd send someone over. While we were waiting, my family took it upon ourselves to change his wet sheets and bloody hospital gown, readjust him, and help him eat. Unfortunately, Karen returned and the unwarranted aggression continued. She interjected herself into a family discussion about the quality of care, and some have became the victim in the situation, and went as far as informing my family, myself, mother, aunt, and sister, that she wouldn't be losing her peace for anyone today, and I advised that I had a nasty attitude. I informed her that our frustrations were warranted and that my valid concerns of the continually poor quality of care weren't directly solely at her, but the staff as a collective, and informed her that she didn't know me well enough to accuse me of having a nasty attitude, to which she replied, "And I don't want to know you." At this point, I realized her lack of empathy in conjunction with her defensiveness wouldn't allow for a productive conversation. The best thing I could do for my loved one was again try to have him moved to a different hospital. The care is so poor here. My family is currently looking to have his discharge against medical advice, just so we can immediately move to a facility where we can be confident in the care he receives in our absence. Jeez, dirty. So all the nurses in February truly regret the experience as shared, if not already done so. Okay. 8 months ago. First time I came here, I did not have to wait. I am 8 weeks pregnant with gallbladder issues. Second time the next day, I was having a false miscarriage and they made me wait 3 hours. They sent me home. Today, I'm coming back because of my gallbladder, and I have waited 5 hours, and they told me it would be another 2 or 3 hours to be seen. No help, no relief. Just two ladies telling me I'm not as important and must wait for a room. In the meantime, there are other people being seen that came in way after me. I am pregnant. My gallbladder is exploding. If I could move and drive myself, I would have looked for another place tonight. Very upset. I'm still waiting and it's been over 6 hours. Are they totally for real? I am pregnant and almost had a miscarriage yesterday. No one cares. Update. Been here since 12:30 a.m. It's now 7:30 and still waiting. I wish they would care. Going into hour 8 now. 8 months ago. This is the worst ER you can ever go to. Nurse Christine is rude and beyond unprofessional. After waiting 2 hours for a room, not a single nurse came in the room to assess for 45 minutes. And when I went calmly to the nurse's station to ask what's going on and state that not a single person has come to let me know what's going on or even assess me, Christine, the nurse, told me to stop yelling at her. Never once did I raise my voice. I voiced my problem that I am having since no one came to check and assess. Christine then called security and told them I screamed at her and recorded it on my phone, none of which is true. This hospital is a joke, and the fact they hire nurses like that are very unprofessional. Apparently, being a sick patient and wanting to find out when a nurse is going to help me requires for security to be called and lies to be told by Christine the nurse. God forbid I go to the ER for help and want to know why no one is helping me. 10 months ago. This is a review against the nursing staff regarding the poor care and mistreatment of my mother-in-law on November 6, 2022. My mother-in-law was transferred from the emergency to the cardiac care unit on the 4th floor. The orderly placed her on the bed in an uncomfortable position. She could not be moved by the orderly because of the severe pain that she was involved in, as well as severe discomfort on the side of her chest. The initial positioning on the bed would have been uncomfortable for anyone, much less a heart patient in severe pain. Upon her arrival, there was no one there to receive my mother-in-law in her newly assigned room and make her comfortable upon arrival. She was not checked in and properly received by the staff. I waited for 30 minutes for some type of care to be rendered to my mother-in-law. My mother-in-law laid in her bed in agony. If it wasn't for my insistence, she would not have gotten any care at all. I asked 3 various staff members for a pillow to make my mother-in-law comfortable. She never received a pillow. Secondly, my mother-in-law was in severe pain, and I asked that she be treated for the pain. No one checked in on her, checked her vitals, or attached any monitoring equipment to her, as my mother-in-law is a heart patient. The tray table in the room was disgusting, a sticky mess with pieces that appeared to be old food particles on the surface of the table. Upon arrival, my mother-in-law didn't receive any towels or bedside accessories. It only wasn't until I waited 30 minutes that I told the change nurse that I'll be filing a complaint against her and the staff on the floor for my mother-in-law's mistreatment that finally motivated her and her staff to attend to her. 2 pillows and new linen appeared, a nurse's aide, and the charge nurse finally rendered care. My mother-in-law should have received adequate care and respect upon her arrival into her room. It shouldn't take the threat of a complaint against the charge nurse and her staff for her to have received proper care. I feel the lack of care rendered by the hospital staff disgusting, and I was terribly distressed over the discomfort and lack of care that my mother-in-law received. I wouldn't want a dog mistreated like my mother-in-law was upon her arrival into her room. The lack of treatment and care was inexcusable and unacceptable. I doubt any action will be taken against any of the staff. I can only hope that maybe others won't have the same miserable experience. Just take a look at all the terrible reviews of this place. 10 months ago, I was told my ultrasound results were clear by Dr. Ruiz in the ER. They were not Dr. Ruiz also told me before discharging me this is exactly how I would treat my family. Huge red flag for me. I went to a different hospital that properly diagnosed me. I was misdiagnosed here, and when I complained, they opened an investigation. The investigation concluded I was contacted by the medical director, who only apologized for the doctor misdiagnosing and lying to me about my results. Do not recommend this ER. A year ago. I want to start off by saying I am completely unsatisfied with this place. I waited 4 hours, not exaggerating, 4 hours. I got there at 9:30 and by 1 a.m. I was still waiting in the waiting area. The entire time they called people who came in after me. The receptionist is beyond rude. If you ask her for a wait time, she will say go ask the nurse and shoo you away as if the nurse isn't with another patient taking vitals. There are sick people throwing up in barf bags in the middle of the floor, making gag noises, and all of the nurses are walking past as if it was normal. When asking the attending nurse how long the wait would be, she said, "You're next. We have no beds." As I sat and watched 6 other people who checked in after me get called before me. If I could give this place 0 stars, I would. Lack of care and attention from the staff who have sick patients waiting to be seen. Would not recommend this place. A year ago. If you can go to another hospital, just do that. Came in at 19 weeks pregnant with a severe UTI, as they stated, and had to be admitted overnight as I was moved from the ER to the third floor. I should never have agreed to stay overnight. The staff on the third floor east were very incompetent. Couldn't answer simple questions, and I didn't receive any more antibiotics while I was upstairs. I pressed my call bell twice for my nurse or any nurse and only got a PCP that couldn't answer my questions come to my room. The second time I had to call the hospital from my phone to get the charge nurse for that floor to come see me. What was the point to keep me overnight if I was going to be treated and wouldn't receive satisfactory care? Like I say, if you can go elsewhere, do that. This is also one of the dirtiest hospitals I've ever been to since Jackson South. I don't even see why or how they're part of Broward Health Network. 1 star is me being generous. This hospital and the staff deserve 0 stars. I won't be back. A year ago, went to the hospital because I had abdominal pain. I also had back pain, but the abdominal pain was the reason I was there. Sat in the uncomfortable chairs for over 3.5 hours and still was not being seen. The triage nurse seemed to be spiteful and therefore send 5 people who came after me in. My last time at this emergency room. Don't use this emergency room. If I wasn't hurting and needed the care, I would leave just like many others who left. A year ago. My son was brought here with horrible pain. They kept him here multiple days, diagnosed with a severe colitis. The problem came with pain management. Literally every 3 hours, my son was screaming in pain, and we had to fight with nurses and doctors to get his pain managed. Every 3 hours, they let his pain spike to a 10, his body convulsing and blacking out. They made him wait in the name of the doctor's orders. Every time we asked to speak with pain management team, we were put off and told they would call them. When they did show up a day later, they told us one thing and they did another. The nurse informed us that they changed orders after we talked to them and cut his meds in half. This has been hands down the worst experience ever. Sitting in the hospital room with my child screaming for someone to help, please help him, and have to fight to get someone in here. He has a serious disease that is extremely painful, and they were uncaring and horrible. Nurses were sympathetic and kind, but higher ups had the power and they were unwilling to help. Nurses were helpless to help us. 0 stars is too many. 11 months ago. Waited 3 hours and a half with pain. When I decided to leave, the personnel did not show compassion. Please, please do not go here. I decided to come to an emergency room at 441 West Boca Medical Center. An ultrasound of my leg was done in 10 minutes after I crossed the door. In Broward Health, waiting 3.5 hours to be seen and never happened. Huge difference. Do not put your life in jeopardy. A year ago. The ER here is really substandard. Twice I have gone in and neither time did the MD examine me. They rely on blood work and x-rays only, and if those are fine, they send you home. As a medical doctor myself, I don't know what a complete ER history and physical entails, and they don't do either. I also wanted to read a document before I signed it, and there was no way for me to read it. The staff member seemed to not understand the concept of informed consent or the rights of the patients. The staff ignores you even when there is virtually no one in the ER. Find a better one, or you will be wasting your time and not getting a thorough assessment. 3 years ago. Well, I went to the hospital Thursday afternoon for pain. I had a wonderful experience in the ER. The doctor, nurses, and specialists were extremely caring and definitely listened to any I had to say. They constantly checked up on me to make sure I was okay. Ended up having to stay over 2 nights as I had to have surgery. The minute I went upstairs to an overnight room, I was treated like an inconvenience. One nurse didn't want to give me the full dose of my medicine after the doctor clearly told me what dose. She gave me half, and when I asked her about it, she didn't say anything, just walked out of the room. I had to call every 4 to 5 hours for medicine and had to wait over an hour to get it every time. And when I thought to call earlier for it so I would get it before the pain was unbearable, I was told to wait. Also, I had an allergic reaction to my medicine and told my nurse I was not going to take that again. She tried to give it to me and said she can give me something else on top of it for the allergic reaction. I asked her to talk to the doctor or pharmacy for something different since the reaction was bad and she gave me the worst attitude. I couldn't even talk to my nurses about my pain. I just wanted to leave. Mind you, I'm in serious pain waiting to have surgery. I've also had great experience at this hospital since I was very young, so to me this was a very big shock to be treated this poorly. I will not be coming to this hospital again. I'm so upset about this experience. 2 years ago, I'm given 1 star because of the mother's clinic, brand new with brand new nurses, fresh out of nursing school with no experience with labor or delivery. Jenny was my issues nurse, didn't know how to proper pelvic exam, and her bedside manners was poor. I eventually asked for another nurse with more experience. At this time, the baby was already crowning. I delivered with no doctor. Dr. Mogg was on call. I only saw the doctor approximately 20 minutes after delivering my baby. I wait with the placenta and clamps still attached. Very horrible experience as a first time mommy. I'm writing this letter because it's almost a year and I'm still having issues with the perineal that was torn. Damn, that's like a major fuck up. Okay, a year ago. My son had surgery yesterday and everything was well until after surgery. The nurses are way too rough on kids. They literally held down my son so hard to the bed and covered his nose for him to swallow some medicine right after surgery. My son was kicking and struggling because he could not breathe due to them covering his nose. At the end, spit out the medicine. If this is their way, like they said, of giving medicine to the kids, I feel bad for the younger kids. My son is 7. My son was in pain and was drowsy, of course, refused to take medicine after surgery, but they forced it down. Today, my son is extremely sore from his arms and neck because of how tight those heartless nurses held him down. Unfortunately, my son is due for another procedure in 6 months, and I pray that we get different nurses this time. As a mom, I feel like I should have spoken up. Please don't let the nurses force anything on your kids. A year ago. Spent 6 hours at the ER and they did absolutely nothing for me. Let's start by saying I'm 25 weeks pregnant. I went to the ER asking to be seen at labor and delivery because I was having pre-eclampsia symptoms. I was having a headache that wouldn't go away for 3 days, blurred vision, and high blood pressure. They told me because I didn't have any pain in my belly, I had to wait at the ER. Hours passed and I complained that I was feeling like I was going to faint and I was feeling cramping. They said I needed to wait. Finally, after hours, I was put in the hallway. The rooms in the hallway I was in were emptied and then filled by other people, despite me asking 3 different staff members to please put me in a room. I was told the rooms weren't any safer than the hallway. After waiting for my results, they tell me they see nothing wrong with me but to be on bed rest till I see my OB and that my urine might be dirty, but they don't want to do anything about it because I need to wait to see my OB because he's the specialist, not them. So I wasted 6 hours of my life and nothing was accomplished. I didn't receive any treatment and I left feeling just as bad, if not worse, than when I got there. Oh, almost forgot. I was handed a blanket after hours of being in the hallway and the blanket had green snot on it. I was handed a dirty blanket. Do not go to this ER. They are awful. A year ago. This hospital has a Karen in the emergency room by the name of Nurse Jenny. She was extremely rude, no compassion for my pain and weakness. Her words were harsh, and I had no energy to respond. She attacked me verbally when I was at my weakest. I do not recommend any African Americans go to this hospital. If she had the power to let me die, I believe with all my heart she would kill me. What happened to the nurturing and caring nurses? What happened to humanity? 2 years ago. I am posting and taking the time to write this out only because of how heartbroken and disappointed I am over this situation, hoping that this does not happen to anyone else. 2 weeks ago, I went to Broward Health Coral Springs with severe abdominal pain. Surgeon requested I have an MRI for diagnostic purposes. When the tech came to get me with the wheelchair, she asked me to remove all my jewelry, that it was not allowed in procedure. I have never taken off my wedding rings, but this was a special situation, so I complied. I had a hard time taking them off, so the tech and surgeon that walked in to let me know of the procedures even suggested I use soap to remove them. I was able to remove my rings and place them on the counter in the room before the tech took me to my procedure. When I returned from my MRI, I went straight to the bed. They gave me my medication for my severe pain, which made me drowsy, and I fell right asleep. I was so uncomfortable at that time, I honestly forgot all about my wedding rings. When I was comfortable enough to be clear again, I immediately went looking for my rings. They were nowhere to be found. Hospital says they are not responsible because tech said she did not tell me to take off my rings off. I am not sure which upsets me more, the fact that tech is lying or the fact that I have lost my rings and no one at the hospital is really putting much important to it. Just devastating. Hospital said they would do an internal investigation and review the cameras to see what they find for a report, claim, or restitution. I even pointed out to review footage that I went down the hall then in my room with wedding rings, and when going to procedure, rings were off. No response regarding this. The response they gave me after their investigation was, "This is Broward Health Coral Springs Security Department. I was calling to inform you that I included in the investigation, and I have found that no one had entered your room other than the medical staff while you were present. We are closing out your case." My surgery went well and I am recovering nicely. I'm very thankful to the surgeon and hospital staff in that regard. However, my wedding rings had obviously immeasurable sentimental value, especially since my father had made them for me. This whole situation regarding my rings disappearing from my hospital room has been disheartening. The lack of action from the hospital and quick dismissal has made this situation all worse. They have refused to take any responsibility or offer any solution, even though, as they pointed out, only staff went into my room. 2 years ago, my wife and I went to the hospital with our 16-month-old son. He had a 104 fever and throwing up. We went to check in at the registration. The lady told us at the front to wait outside as there was no space for kids in the waiting area, as adults were waiting in the kids section. People were coughing all over the place and not wearing masks properly. We parked our car in the front of the ER to keep our son in the air conditioning. My son kept throwing up in the parking lot, and no one cared about our son being sick. I was told by a security guard to move my car. I advised the security guard that we were keeping our son in there because it was too hot for him to be standing outside in the Florida heat. He advised that we still cannot park there. However, not one thing was said to any of the people in the emergency room not wearing masks at all. After 45 minutes, I went back into the registration and asked what is going on. My son continues to throw up. My wife was covered in vomit. The registration lady even advised us that the children's ER was not crowded and didn't understand what was taking so long for our son to be seen. If you have a sick child, do not go there. Coral Springs Hospital, they are not prioritizing children and they don't have a separate section for kids to sit. I have called multiple times to voice my frustration, but they don't care. I know that nothing can be done for my child, but I would hope that Coral Springs Hospital will do better in the future for children coming in the ER who need help and have a section just for children who are unable to wear a mask or unable to get the vaccine so they are not exposed to COVID-19, so they do not have to be exposed to the extreme elements of Florida. Thankfully, with further attempts to contact you, you were able to speak with our emergency department manager. We are confident the recommendations discussed will be implemented and monitored to ensure we continue to provide. Okay, wow, they really connect the review to what they did. Okay, a year ago. Worst hospital, especially for kids, came in with vomiting, headache, bellyache, and dehydrated. Doctor only did vomiting pill in exactly 5 hours, not even fluid. Nurse forgot to discharge me while they only did one vomiting pill. What a terrible hospital. My child's still the same while they did just nothing. Wow. A year ago, the worst experience with the ER is going in with excruciating pain, not knowing what is going on with you, and bam, without a test or valid observation, forcefully discharged by the rudest charge nurse in the world. Backtrack, enter with pain, got to poke around by the doctor that prescribed a numbing GI cocktail, which didn't take the pain away, instead exasperated the headache. I was later told acid control meds were prescribed and I was discharged. Asked to see someone else because I felt I wasn't adequately treated. The charge nurse, Eric, has no people skills. You are discharged repeatedly, proceeds to physically remove all vital equipment and take the cover off me. He physically threw me out. The Dr. Ruiz, female, nowhere in sight. I walked out the way I walked in, and for someone not too used to or expecting that, I was utterly shocked and dismayed. In unbelief of all my ER visits, either with family or me, I never have. This level of care is appalling. If you had a bad day, that should not be reflected on me. I ended up coming home suffering through the pain until I could get the advice of my primary care. If 0 stars could be given, would have given that. 2 years ago. This is the worst hospital. I do not advise anyone on going there. I took my 1-year-old there with high fever and waited almost 3 hours in the lobby without assistance. Finally, a nurse came out to give him Motrin and sent us back to the lobby. After waiting for so long, I decided to leave and take him to Boca West. Turns out my son had pneumonia. This people charged me over $400 for simply taking his temperature. I called in to see why I received this bill and was told that since he went through triage, I was charged. And to keep in mind to next time take him to his doctor instead of the emergency, if his doctor works 10 p.m. on the weekend. A year ago, they have adults waiting in the children's ER, and after being in a room for over an hour and a half with an infant, turns out the radiologist and doctor on staff misdiagnosed my baby's leg injury. After following up with a specialist, I was told that my baby's injury was more serious than just foot pain, as she put on the discharge paper. Do not come to this hospital or any of their affiliates. Everyone has attitudes and does not care about the patients. It's not clean or ran properly. 2 years ago, went to ER for chest pain. Was told I was going to be admitted at 1 a.m. At 6:15 a.m., still waiting on gurney to be transferred. I told them I wanted to leave. They gave me a paper to sign. I signed and wrote how long I had to wait. The nurse told me I was not allowed to write on the paper, so I threw the paper in the garbage. No one spoke to me about my issues. You would think that the charge nurse would at least talk to me about my issues. If I had not left, I would have more than likely waited until 9 a.m. or later, SMH. In the end, no one even recorded my medical history or what medical I take. During my 6 or 7 hour experience, they took my BP one time, even though it was very high during triage. SMH. 2 years ago, would give a minus if I could. My husband went for a stomach bug he got. They told him I could go in the emergency room with him once he tested negative for COVID. He was feeling horrible, high fever, and dehydrated. Once the test came back negative, they refused to let me back there, although there's signs stating one person can accompany you if negative, along with them telling us that prior. Also, while he was waiting for hours, he asked for water and ice, which was refused. They were rude, made him feel uncomfortable, and accused him of using my urine because the front desk had him get a sample while waiting in the room. This was outlandish. He's sick and needs to figure out what's going on with him. Extremely unsatisfied with their service. Do better for people. You see signs everywhere. Best emergency room service. Definitely not. Going back home with no answers. Huge waste of time. 2 years ago. This was the first time and last time, if I can help it, that my son received post-operative inpatient care at Broward Health Coral Springs. Since he's post-operative, he's still ordered not to have anything by mouth, so he hasn't eaten in 7 days. Last night at 8:10 p.m., my son's father, only one parent allowed due to COVID, realized that the IV in my son's arm was leaking. After failed attempts and 3 hours of runaround, they were able to put another IV in his arm, only this time it wasn't in a vein, so the fluids were just infiltrated under the skin. At 3 a.m., they realized what they'd done and decided to remove the IV completely. At 7 a.m., I returned to relieve my son's father, and after a lot of noise making, 3 more unsuccessful attempts and 20-minute follow ups, they had a nurse come from the outpatient to insert the IV in the vein properly, and she was successful the first time. By this time, it was 11 a.m., so he had been without proper fluids for 15 hours. My son is on the tail end of his stay, no dehydration, no other nurses, doctors ever had problem finding veins. Said all of this to say I don't think anyone on the pediatric unit is experienced enough to insert an IV into a child, and especially not during the nighttime, which is extremely concerning. After 12 hours, I'm sitting here waiting for a transfer because I no longer feel confident that the staff can provide an adequate level of care. Dr. Markley, Dr. Lasco, Dr. Vino, and Dr. Bishop are the best things that are happening in this hospital. A year ago, we lost our mom in this hospital. No attention, poor medical care. Doctor showed up 4 days later, kept her in ER for 24 hours plus, exposing her to viruses. Almost no doctor visits or calls, not even return calls. Incompetent staff and poor medical care all the way. Social workers not reliable, unresponsive nursing staff and doctors, and everyone should know all doctors are competent. Not all doctors are competent. Keep your loved ones away from this hospital. 2 years ago. Don't walk, run away from this hospital. I have requested to speak to the director of the hospital multiple times, and I get transferred all around the hospital to more incompetence. Gave birth to my son a year ago and still getting collection calls for items billed incorrectly. Forget trying to speak to the billing department, incompetent. I even got transferred to an administrator who said she would look into it almost a week ago. Nothing. I am over it. Never referring anyone here, nor am I ever coming back. Complete joke. 2 years ago. To update my horrible experience at this so-called hospital, not only did I not receive the care I needed, but this place billed my insurance for $14,000 for their wonderful service. Incredible. This is the reason why no one can afford health care. Not only did a physician never examine me while I sat in a room for hours, these charges are only for x-rays, CT labs, and IV observation. Disgusting, that is all I can say. Against my better judgment, because I heard this place was bad, I made the mistake to go to CSMCER at my doctor's request. In my 6 hours in a room at the ER, I was not examined by a physician. The nurses were rude and incompetent. CT was done because of my rectal bleeding. I had to walk to nursing desk several times to ask for someone to come to talk to me. Finally, a very rude nurse handed me the CT report, and still nobody explained my diagnosis. Very rudely, I was told my gastro told them to admit me, which I later found out from him was not true. Was finally moved to a room upstairs where things did not improve. For 40 minutes, I sat in a bed waiting for anyone to come check on me. My husband got there, and every question he asked, the staff just looked at each other, hoping the other would have an answer. Thank God I was not so ill that I was able to walk out of this so-called hospital. We need a real hospital in Coral Springs. Horrible, horrible. Who certified or inspected this place to be a medical facility? Be careful and never go to this place. 2 years ago, our 92-year-old mom was hospitalized 10 days after receiving the COVID vaccine. They told us she was COVID positive on 2/20. After our persistent request, she was tested again and tested negative 4 days ago. She also was clear for any other issues. Since then, we wanted her to come home or at least be transferred to a non COVID area so my wife could be with her. Communication was non existent. We would call several times a day just to be told they will get back to us. Nothing. She desperately wants to go home, but no one seemed to be able to make the decision. They throw the ball at each other. They say they'll call back and never do. This has been one of the worst experiences of our lives. We had no choice but to go in person and to push, and finally we got answers and she is coming home. You judge if you would like to go there for care. On a side note, we still don't know how she could have contracted the virus, except for the time we took for her to get the vaccine. We sheltered her to the max, and also we all tested negative. Go figure. Update: we finally got our mom home, and the negligence is evident. Shame on them. Never again. 2 years ago. If you have an emergency, don't come here. Super crowded at the ER, which is always a bad sign. Understaffed for an ER. They spent all the time for registration just to wait and wait and wait and wait. Yes, lots of people. There were at least a dozen people in the lobby just waiting for someone to see them, probably for hours already. Emergency for you is not an emergency for them. Forget about it. They will get to you when they can. It's a test of patience to be here. I called around to other hospitals to ask about ER wait time. We left after waiting 20 minutes and went to Coconut Creek ER and admitted right in and was escorted to our room in less than 2 minutes. Wow, night and day. Broward Health Coral Springs gets a F, 0 stars if that's possible. A year ago, the worst. Someone in the room across from me had COVID and just tested positive for I don't know if the guy was her nurse or doctor, but he yelled it from the door and he was very loud, so I heard everything after the lady left. Someone went to clean the room. The same guy then yelled from the other room, "Oh, she has COVID." The lady looked at him and he said, "Just letting you know, I don't care." And all she did was change the sheets, then rolled another patient in there. My nurse was everywhere without a glove, even pulled my mask down to give me pills. Disgusted. Isn't that a HIPAA violation? Going to get tested in a few days because I hated how my nurse pulled my mask down and took my IV out without gloves. Don't go there. 2 years ago, the worst experience of my life. The things that happened are too numerous to name, but I nor anyone in my family would never step foot in this so-called hospital ever again. The experience was a complete disgrace, and the lack of service and compassion was something I have never ever seen before. Shameful. They are lucky they aren't being sued. A year ago. Terrible care. They don't answer the phone. Sometimes I had to let it ring for 15 minutes and hung up, called again, and waited another 15 minutes. Doctors are often impossible to reach. On-call number. Didn't even know that the doctor I called was working at Broward Health Coral Springs. Patient had to wait 30 minutes for a bedpan. 2 years ago. Worst hospital. They have almost no nurses at night. My daughter called the nurse 100 times last night from 9:30 p.m. until 6:30 a.m. and was never answered, nor anyone came to the room. She finally came with a bad attitude at 6:40 a.m. saying that they don't have nurses and left. Nobody showed up for 9 hours. My daughter had to disconnect everything to go to the bathroom herself without any help. Her IV machine was beeping all night. This is 100% unacceptable. No water to drink, nothing for 9 hours. It is criminal. Today I am going to escalate and complain and call authorities. I will find out the names and post it later on. 2 years ago. The worst hospital I've even been to. Please stay away from this place. I was there for a week and they never cleaned the bathroom with garbage overflowing, and I think they got some kind of funding if they intubate a person, especially Hispanic, that doesn't understand what's going on. Keep your family safe and do not take them to the hospital. 2 years ago. Why did they not clean their bathrooms / replace sheets for their patients? It's funny how some things are just repeated over and over again. So, that concludes the reviews from Broward Health Coral Springs. Finally, we come to Broward Health Imperial Point on North Federal Highway in Fort Lauderdale. 4 months ago. My fiance has been in pain with his right side, waking up every day feeling nauseous and even constant nausea. He has been having trouble eating and losing an extreme amount of weight. Our third time there tonight due to now noticing a mass in his left abdomen. The second time we went there, did a CT scan and stated pancreas levels were up. As of tonight, got no answers. We felt like they didn't even want us there, rushing us out. They did an x-ray and the doctor came back, said they didn't find anything, says see a GI. Doctor said yep, didn't even look my fiance in the eye. Also didn't seem to care about the amount of weight loss. I'm severely disappointed. 10 months ago. My husband is now home and 65 pounds lighter. The hospital stay was horrible. Between the doctors on the case and the hospital incompetence, they almost killed my husband. He went to the hospital ER for internal bleeding and pain in his groin area. He had an internal bleed 15 years ago that he almost died from. Um, the ER might be good at Imperial Point, but the charge nurse on the fifth floor doesn't have a clue how to do her job, and case management office is a joke. Most of the nurses and other staff, including cafeteria workers, are unhappy. Thought Holy Cross had gone downhill in the last 20 years after they got bought out by Trinity. Imperial Point is state run, and I have never seen such incompetence like that in my life. They ran up his hospital stay, which wasn't necessary. They stuck a second drain tube in him. That was not necessary. The doctor tore his intestine and put a hole in his colon, which the doctor admitted openly. I do appreciate the doctor's honesty in the matter, and at least they told my husband and I what happened. But case management and the charge nurse purposely held up sending info to home health so my husband could be discharged before the holiday in order for the hospital to gain more money and revenue for extra days until home health could be approved. The ER did not run the appropriate test for internal bleeding when he came into the hospital. They mislabeled it as hemorrhoids when it was actually internal bleeding. Imperial Point has a nurse running administration. The hospital is a joke. 11 months ago, I arrived at the ER via rescue and was there about 5 to 6 hours on October 10th, and I left traumatized. I thought I was having a heart attack as well as having severe back pain for about 2 to 3 weeks. I was told I was to be given 2 bags of saline for fluids as well as a medicine to help with nausea because they also wanted to give me morphine for the pain, and morphine causes nausea. Halfway through the first 2 bags, we went to do a CT scan, which hurt very much because of the pain and I've been having in my back. When I returned to the spot in the hallway I was stationed to, I was never hooked up to complete the bags of saline. I was never told I was given morphine and was in pain and discomfort my entire time in the ER. However, after shift change, the nurses were under the impression I was given morphine at 6:45 p.m. My mother, father, and girlfriend were there with me, and we all don't believe I was given morphine, but it was logged that I did. I alerted the nurses that this was the case. Also showed them that the half-empty bags next to me. However, it was logged that I did receive it, but I was still in pain and discomfort. I asked to speak with the doctor. When the doctor came to me, he explained that he thought I had a bad strain in my back, but was very dismissive when I asked about my high blood pressure and heart rate and replied, "So now you have high blood pressure?" Mind you, I thought I was having a heart attack a few hours ago. During this conversation, a very loud person was brought in the ER by the police, and the doctor walked away from me and said, "I'll talk to you later," and literally walked away from me while I'm trying to figure out what the heck is going on with me and what all the tests showed. I never saw him again or spoke with him after this. About 30 minutes to an hour later, I was dismissed with a prescription for lidocaine patches. It was one of the worst traumatic days of my life, and the level of care or lack thereof has traumatized me even more, and I will never be back to seek care from this hospital. After having a bad experience with Fort Lauderdale Behavioral Health, I brought my mother to Imperial Point, and they actually managed to be the absolute worst place to bring someone with a mental illness. Super unprofessional and medical malpractice slash medical neglect is going on at this facility. They do not care for their patients at all. There is no correspondence, no following up, no checking in, not even discharge documentation or steps for the patient for life after treatment. And I guess that is because they don't even give some kind of treatment to their patients. They do not let you know what is going on or answer any of my phone calls. When I try to get something resolved in regarding a patient, my own mother, they just throw blame at each other. Not only do they not take their mental health patients seriously, but they also discharge their patients before they are ready and just abandon them patients anywhere. The first time they discharged my mother, they just dropped her off at the front door without any keys or phone. I went to her house to check on her and she was missing. The second time that they discharged her, they didn't even call me, even though they have in past, and I am the emergency contact, nor did they call any family members to let us know she was discharged. One of the social workers, Shannon, is the only person I was able to talk to this whole time, and she was extremely rude, lied, and did not help my mother like she and the others at the facility were supposed to. This place is disgusting, they don't even deserve 1 star, and they will be served for their crimes because this cannot be okay or legal. 10 months ago. Horrible. Very hard to get reports about your loved one. No one seems to know what's going on. One nurse commented on my mother's IV stick not looking good and left the room and didn't come back. The shift nurse came an hour later, walked into the room, and told us she still has to receive her shift change report. Mind you, this was 8 p.m. and the shift change is at 7 p.m. In other facilities, the social worker usually called. At this facility, I have called the social worker twice and keep getting a voicemail on what sounds like a very antiquated phone. I'm simply trying to find out my mother's treatment plan. When I visit in person or call, my mother's nurse seems to never be available. No one should have to wonder if their elderly mother is safe in a medical facility. 3 months ago. Just realized I had never posted my review on Google. Going back to summer of 2020 at the start of COVID, I had went to the ER for intense stomach pain. Without testing me for any other illnesses or giving pain medication, at least they told me that I must get a COVID test, to which I refused only because I had been prone to stomach virus and had a traumatic event as a child with swabbing in my nostril. Might I add, in the room beside me, nurses and doctors were constraining a man who clearly did not want to be tested. Instead, the nurses and doctors yelled, "Lay down and stop moving." Long story short, the Dr. Delgado told me, "You know you're going to kill everyone around you." And with that being said, I was discharged with only having blood work taken, no IV, and was told to take Tylenol. Thank God for Broward North, who took time to analyze my pain and give me pain meds for the stomach pain. Stomach pain was not a symptom of COVID at this time, hence why it was difficult to rule it if it was COVID or not. I was indeed COVID positive, and my whole family was as well. And glory to God, no doctor, I did not die, nor did my family. Haven't been to Imperial Point since, and never will. A year ago, I would not send my worst enemy here. The ambulance took my wife here as it was the closest. We are new to this area. She fell and had fractured tailbone and only performed a CT scan, and when there was nerve damage also. They only treated her for pain for 14 days, then sent her to a nursing home, which I checked her out the same night. I took her to a spinal specialist, and they could not believe they did not perform an MRI and actually treat her. I later found out that the doctor who treated her was not a fully qualified doctor. The specialist sent us immediately to the ER at another hospital, which she currently is getting good professional treatment and will require surgery. I'm currently investigating a lawsuit. Please check out the current lawsuits against this hospital. I also agree with the prior posts about they are very rude. Once you check posts, you cannot talk to the attending doctor. They informed me on 2 occasions that once a patient is checked out, they have no further contact. Screw them. A year ago. Staff is completely overworked. The nurses are expected to do everything. Management is focused on what looks good on paper. Nursing assistants are few in number on the floors in order to save money. This hospital needs more nursing assistants so that nurses can do their jobs. They should cut their management staff and put that money towards nursing assistants. The reason the patients are not satisfied is because the people who actually take care of them are being overwhelmed by the demands management is putting on them. A year ago. It was my second time admitted to Imperial Point this year. First time, not so bad. Second, nurse staff was clueless on most things. I had a doctor who sent his PA to tell me I was having surgery and never even saw or heard of the doctor. I waited numerous times over a half hour after I hit the call light. Then the nurse in charge number they have on your room board, they rarely answered. Even my doctor said, "Don't go there anymore." 2 years ago, patient beware, good doctors. They sewed me up and took good care of me. This is where you need to be cautious. Upon dismissal from my visit, I was told to come back to Imperial Point to have my stitches removed. I asked at that moment, do I need to come back to ER for this? Will I be charged again $150 for the visit? I was told it would not be charged as it was a follow-up to have the stitches removed. Well, they charged me to sit at the administration desk and have a worker who was working the desk remove them for me. Fast forward a few months and I have a collection agency chasing me after no contact from the hospital nor anything in the mail. How did they run their business over there? I disputed the charge and was told that the administrators rebuked only to go to ER for emergency purposes, but that is a direct conflict of what was communicated to me. I was there and certain of what I was told, but some coward hiding behind customer service makes a decision based on our policy versus what was communicated to the patient. Just know that you may be dealing with what you may be dealing with before you go give them your business. Sorry, you've lost a customer who used to speak highly of your company a year ago. This has to be by far the worst hospital in Broward County. When City ER 2 weeks ago for a swollen ankle, very painful. They told me I had gout. After a week, it was getting worse, so I went back to the ER. This time, they told me I had an infection and prescribed antibiotics. 4 days later, wasn't getting any better. I decided to go to Cleveland Clinic. First thing in Cleveland Clinic they did an EKG, they did an echocardiogram, and found out that I had congested heart failure. Had nothing to do with gout, had nothing to do with an infection. Imperial Point never took a chest x-ray, never took an EKG. My oxygen saturation was 88. They didn't even give me oxygen. Definitely going to file a lawsuit. A year ago. If you want alert, caring, and dutiful staff members, then go somewhere else. This hospital is filled with old employees who only work there because they get free healthcare. Maybe they were skilled back in the day, but now they just don't care. A year ago. Dr. Delgado came in my room for literally 45 seconds and left me here while I'm in severe pain. I called to the nursing station and couldn't hear what the nurse was saying. I tried contacting the nurse again. She responded, "He's busy, stop calling." I thought I heard her wrong, but I didn't. She repeated, "He's busy, stop calling." The care nurse was lovely, but it seemed like she was scared to speak to anyone about helping me. 2 years ago, if I could give this place a negative 5 stars, I would. As a physician, I've worked in a handful of different care settings, and I will say this place is by far the worst with regards to a value of care and value for the patient. My brother was hospitalized as an inpatient for 7 days, where we, his family, came daily during his allotted visitation time to see him. Numerous times I called to speak to a physician regarding his length of stay and why he was not being discharged. Each time I was directed to a nurse who unfortunately didn't know any of the medical reasons, diagnosis, or basically care at all for my brother. In the 7 days my brother was here, his family was never once called to be updated by a nurse or physician. We had one 3-minute phone call with a case manager to verify that he lived with us, and that was the only hospital initiated conversation. To add to the spectacle, my brother was never fully sure who his doctor was, who was coming in to see him, or even at what time. Multiple times I would call at 1500 or 1600, and the nurse would tell me that my brother was yet to be seen by a physician, that there were no updates. By the time I was able to call back later in the evening, the night shift nurse had come in and knew even less of what was going on with my brother's condition. It's an unfortunate happenstance that the medical field be disgraced with the level of care this place demonstrated towards my brother. The physicians, medical staff, and management should be ashamed. As a medical professional and doctor, I would stay as far away from this institution as possible. A year ago, I came into the emergency room with severe pain in my stomach. I have a huge ovarian cyst on my ovaries and very bad endometriosis. Dr. Silverman was just discharging people and not caring about the patients. I told him how much pain I'm in, and he just gave me some medicine and sent me on my way and told me to go to a different hospital that they don't have any OBGYN. I couldn't believe it. You just send a patient away when I'm in so much pain. He knows I need surgery. He even said it, but sent me away like I was nothing. I'm going to sue the hospital for this. 2 years ago. This post isn't for me, but for my ex-husband. The level of service here is absolutely disgraceful. My ex-husband came in last night with the bad stomach pains. The doctor that admitted him did so with a diagnosis of possible pancreatitis. Nonetheless, the pain is getting worse. My ex-husband is released after he had been given 3 shots of Dilaudid. I picked him up, but he is still in pain with the painkillers wore off, so another trip to the ER. After we have been waiting 2 hours in a storage closet practically with other medical personnel coming in without the simplest excuse me or just need to step in here real quick, something. No, they just walk right in, rummage through the drawers, take what they need, and walk right out, all without acknowledging us in the room. When asked what are they doing, they actively ignored us. Finally, my ex-husband notices the door, Silverman MD, the doctor Silverman MD that diagnosed him last night. He is baffled that the floor doctor, Helmy MD, treated my ex-husband for sleep apnea. Are you serious? Now that we have been sitting here for almost 4 hours, we have the medical staff come in and start rummaging through the doors again. At least one of the personnel acknowledges us, but still was treated rudely. We still haven't seen the doctor. We've had nurses come in and give us a whole bunch of lies, and my ex-husband is still in pain. Piss poor treatment. We don't know what's going on. A year ago, this hospital basically hires great value nurses and doctors. They put my friend in a coma and gave her medicine that wasn't good for her. Also, they refuse to clean you up if you soil yourself. These nurses and doctors who took an oath to save people's lives are just capping for the internet. Please, Broward, fire all your staff and replace them with people who know how to do their job. 2 years ago, my father checked in for COVID treatment. He was having severe back pain where his lungs were located. To the point he couldn't sit down, he had to lay down. Protocol is to have them check in separately in a different room and wait. He checked in at 9 p.m. and was not seen until 3 a.m. He asked for water since the vending machine was not working to purchase. They told him no. He asked several other times because he was super dehydrated, was still told no. He was so dehydrated that he drank water from the sink of the bathroom several times. He also asked if he could have a blanket since he was having cold chills, again denied. He asked how long until he would be seen, till he would be since 3 hours had already passed and still nothing. The pain in his body was so bad that he laid on the floor. That was the only way to elevate the pain. They came and yelled at him. He couldn't lay on the floor, understanding the floors are filthy since they never clean. But that's besides the point. He waited for 6 hours dehydrated and in pain to be seen for 30 minutes and sent home to get medication from pharmacy. My father is still in pain and having a horrible cough. I am checking him into another hospital. He has had COVID for a week with same symptoms and nothing is getting better. Shame on you guys for treating patients this way. A year ago, got into a car accident, came to Imperial Point Hospital, told them about it, and now I have a pacemaker and my chest hurts, so I want to get it checked out. 2 hours later, this lady walks in also with a pacemaker, and they took her in first because they're the front desk lady's words. Well, she's more important. No, not okay at all. 2 years ago. This hospital was the worst. Unfortunately, I lost my husband here, and it was due to their unprofessional and not knowing what they were doing. I do not recommend this hospital to anyone. The doctors were awful. No callbacks, no updates, no treatment plan. Even tried calling the chief nurse officer, and she never returned my call back. Dr. Carrillo, Dr. Torres, Dr. Nabrizi all know what they did. Stay away from this horrible hospital. Please, if you're reading this, go to another hospital where they have doctors who care about their patients and have a treatment plan. I truly believe they killed him. They did a procedure on him that made him bleed out, and the doctors knew his body wasn't strong enough for it. This hospital is terrible and evil doctors. Have you ever been to a hospital where a doctor fires himself from the case? Something shady was going on. 2 years ago. Honestly, this hospital needs new workers ASAP. At this point, I'm disappointed. I lost two family members to one hospital because they couldn't think fast enough. This hospital sucks. Communication sucks. If you're sick and fighting for your life, just go to Broward General. Don't bother to waste your time. A year ago. Terrible. Do not go. Rude doctor, rude nurse, yelled at patient for not going to regular doctor who had dropped her insurance. A year ago. Worst possible care you can receive. I could write a book about my experience. I will be going to corporate compliance on this. All right. In closing, this episode of Hospital Hell Healthcare Nightmares featuring Fort Lauderdale, Broward County's worst rated hospitals has provided a glimpse into the challenges faced by patients within Broward County's healthcare system. The one-star reviews we've explored shed light on areas in need of improvement, sparking essential conversations about the quality of care and patient experiences. As we wrap up this broadcast, we encourage further discussion and action to enhance healthcare services in Broward County. By addressing the concerns raised by patients and their families, we can work towards a more effective and compassionate healthcare system. Thank you for joining us in this crucial exploration, and we hope it serves as a catalyst for positive change in Broward County's healthcare landscape.